Bwrdd a croeso I gyfarfod y bwrdd. Welcome and good morning and welcome to today's Digital Health and Care Wales board meeting. We're holding, as is the usual practice, the meeting virtually, and people will be able to follow the meeting via a live link, and then after the meeting is concluded, very shortly after the meeting is concluded, a recording of today's meeting will be posted on our website, and people can catch up on the meeting via the links on the website. The meeting is being simultaneously translated from Welsh to English, and they might have changed in terms of the way in which you access this at the moment. If it'll either be you select the globe at the bottom and select original if you want to hear in Welsh, or hear translation in English. Alternatively, you select the third icon from the right and select English, and you may well have to also select mute original at the bottom of that pop-up box in order not to hear both the Welsh feed and the English feed. So hopefully that will work for anyone listening to the meeting from the public. As is usually the case, as I'm doing now, we'll be looking down and not necessarily looking at the camera, so apologise for that. It's following our papers for the meeting, or looking at screens where we might have the papers on a neighbouring screen. We've got 2 breaks scheduled for today, a short comfort break and then a lunch break, and we aim to conclude the meeting by around about 1:30, 1:35. For board members, not aware of anything that's been raised for the consent agenda, but if you do have anything, just let me know at the beginning of that item, section of the meeting when we get to it. Again, in usual practice, don't intend to invite everyone to introduce themselves. We've all got backgrounds where people who are watching externally can see who we are, but I would like to extend a welcome to, when they join us, Joanna Dundon, who's our National Digital Lead for Public Engagement, and then also Sarah Woollett, who's a Partnership and Development Coordinator from the Digital Inclusion Alliance for Wales. And then, as is usual, and it'd be great to see her, Michelle will be joining us later in the meeting for the relevant items that she will cover for us. Apologies for absence, for the 3 apologies today: Rydian Hurl, Executive Medical Director; Sarah Jane Taylor, Director of People and Organisational Development; and Alistair Neil, Independent Member. I don't think, looking around, there are any other apologies that I've missed. No, thank you. Declarations of interest. I've had no declarations of interest indicated in advance of the meeting. Just quickly, if anything's occurred to anyone as they've gone through the papers. No, thank you very much. Then if I move on to the consent agenda, and again, nothing has been raised in advance, and obviously people have had a chance to read all the papers. I don't think there's any. Okay, so I'll move on then. We've got a number of things to do as we go through the consent agenda. If I could ask the board to approve the minutes from the board meeting held on the 25th of May 2023. Thank you. If I could ask the board to approve the private abridged minutes from the private board meeting held on the 25th of May this year. Thank you. And then approve minutes from the extraordinary board meeting held on the 22nd of June 2023. Thank you very much indeed. And there are some items now to note. If I could ask the board to note the actions on the action log, noting that one action is complete and another is underway. To note the forward work plan, to note the foundational economy return, to note the COVID-19 inquiry update, and to note the IM Digital Network highlight report. People happy to do that? Thank you very much indeed. If we move on to the main agenda, and as is usual, we have a shared listening and learning presentation to kick off, but in view of Rydian's apologies, I'm going to hand over to Helen Thomas, the Chief Executive, who will introduce this item and introduce the people who are joining us. So please feel free. Oh, you have turned on your microphone. Oh, your camera's wonderful. Helen, okay. Over to you.
Yeah, thank you, Bwrdd. Thank you, Chair. So I'm delighted to have the opportunity actually to introduce this item. It's a topic close to my heart, and I know one that we've talked about quite a lot as a board. And we'll talk through really the the ongoing work that we want to do in this space. But I am really pleased to be joined by Joe Dundon, who's our National Digital Lead for Public Engagement here at DHCW, and has been doing quite a lot of work through the Digital Services for Patients in the Public programme. And really pleased that Sarah Willett has been able to join us from the Digital Inclusion Alliance Wales, and we've been working very closely, the teams, with Sarah and the work that we need to do. So I will hand over without further ado to Joe and Sarah. So welcome both.
Thank you very much. Thank you very much, Helen. Bwrdd, hello. We're very pleased to be able to talk to you today about digital inclusion in digital health and care Wales. As Helen said, I'm Joe, and I'll pass over to Sarah to introduce herself, and she'll be speaking first. So next slide, please.
Hi, everyone. Thank you very much for having me here today. I am Sarah Willett. I work for Digital Communities Wales, which is the Welsh Government funded digital inclusion programme delivered by Compass in partnership with Swansea University and Good Things Foundation. Compass has been delivering Welsh Government digital inclusion programmes for over 16 years now. The current programme is called Digital Communities Wales, Digital Confidence, Health and Wellbeing. And it started in 2019, and we work with organisations across all sectors in Wales to increase and embed digital inclusion to ensure that no one is left behind. DCW is joint funded by Welsh Government's Communities and Tackling Poverty Division and the Health and Social Care Division. Welsh Government recognised the need for digital inclusion to be embedded into health and care in Wales, and you can see from the stats on this slide why that is. I'm sure you've heard of the inverse care law, where those most in need of services are the least likely to be able to access them. Well, now we are at a risk of having a digital inverse care law. So those most likely to need health and social care services are also the people most likely to be digitally excluded. And with the move to digitally transform services, this is very important. I'd also like to point out that this 7% that you can see can be misleading. These are people who are entirely digitally excluded. If you look at the 5 essential digital skills, you find that of those 93% who are online, 22% of those are not able or confident in using all 5 digital skills, making them partially digitally excluded as well. And when you factor in the current cost of living crisis, causing people to give up their broadband contracts or being unable to replace old tech and devices, the number goes up again. Across the UK, over 1 million people gave up their broadband contracts over the past year due to rising costs. Next slide, please. We wanted to share comments about digital inclusion. One is from a member of the Digital Services for Patients and the Public Programme's Patient and Public Assurance Group, who has asked that we keep in mind that not everything is accessible digitally. And another from some research conducted on behalf of Digital Maternity Cymraeg programme about deprivation and digital poverty, and from Welsh Government in their Learning Disability Delivery and Implementation Plan, which states that staff and stakeholders will be improving connections for people with learning disability. I'd also add here that the Older People's Commissioner is currently reviewing public bodies' responses to their Section 12 guidance, which requires public bodies to not only provide those non-digital routes to services, but to also provide support to those who choose to gain the skills and confidence to be able to connect online. Next slide, please. So a large part of my role at Digital Communities Wales is running Digital Inclusion Alliance Wales. The Alliance is a network of a diverse range of over 100 organisations. And our primary mission is to ensure that everyone who wants to in Wales is able to access and use digital tools and technologies in their everyday lives and has the confidence to do so. To work towards this mission, we published our agenda for digital inclusion, from inclusion to resilience, with our 5 main priorities, which you can see here. As a network, we hold quarterly meetings for our members, which are usually centered around one of the 5 priorities. We bring people together to share experiences, to understand policy and strategy, to avoid duplication, to collaborate, to connect with new people and to learn from each other. Fostering collaboration and partnership among our members helps to leverage resources, share knowledge, and develop collective strategies to tackle digital exclusion effectively. One of the things we encourage all Alliance members to do is sign Digital Communities Wales's Digital Inclusion Charter, which has 6 digital inclusion pledges. After you sign the charter, organisations can then move on to accreditation, where they create an action plan outlining their commitment to the 6 pledges. Digital Communities Wales reviews the progress of the plan every 2 years. So going through the process of creating the action plan helps to provide clarity and structure to actually embedding digital inclusion across an organisation in strategy and in day-to-day work. Signing the charter and working towards accreditation is a meaningful process that demonstrates active participation in the Welsh digital inclusion agenda by organisations and ensures a process of monitoring of successes and progression over time. We're very proud to be working with DHCW on this, and I'll pass over to Joe now, who will tell you more about DHCW's work on this area.
Thank you very much, Sarah. Next slide, please. So we're also very proud to be working with Sarah on this too. So what have we been doing since September 2022? After signing the charter, we have held a few meetings with Sarah and her colleagues to develop the draft action plan. In the first meeting, we explored the requirements for accreditation. We have established an informal working group to discuss how to populate the initial plan. Gaining accreditation will be described in the next slides. At the Director's strategic session in April, Helen Thomas, our Chief Executive, kindly agreed to be Executive Lead for Digital Inclusion and chair the DHCW Digital Inclusion Working Group. We are going to be refining the group, and expressions of interest will be open to staff shortly for those wishing to join the group. Next slide, please. So the charter pledges have been mapped to existing and planned activity. I shall give some examples of what we are doing or intend to do in the next couple of slides. However, we are gathering more evidence. The ticks show which have been achieved or are underway, and actually since these slides were produced, we have actually managed to achieve a few more ticks on these slides, which is really great. There are lots of opportunities for digital skills training, including MS365 and the National Data Resource, which offers free training and support to NHS and other public sector staff to support and encourage their digital development and confidence with specific digital tools. Staff can now complete the Digital Capability Framework online self-evaluation tool on the Health Education and Improvement Wales website. For Pledge 2, DHCW are committed to following the Centre for Digital Public Services Digital Services Standards for Wales and the Accessibility Standards known as WCAG, and many programmes are already using these in our systems, such as accessibility audits and user-centred design. We recognise that we need to ensure inclusivity is embedded within all our transformation programmes, projects and delivery of service. This includes reviewing services, identifying engaging and user-centred design with potentially impacted or excluded groups, using familiar vocabulary, giving digitally assisted support, and making our digital services accessible to all. The Digital Inclusion Plan objectives will be in place for the next IMTP, the Integrated Medium Term Plan, as this year it is recorded in Mission 5 that we intend to achieve accreditation. Next slide, please. Digital Communities Wales have been training over 60 digital champions from DHCW and patients and the Public Assurance Group. We will talk more about digital inclusion surveys on the next slide, but here we wanted to highlight how the surveys would be used to identify digital champions. Sorry, the Community Projects Initiative will allow employees to undertake paid voluntary work and activities within their local communities. DHCW wants to work with communities throughout Wales to support the promotion of health and well-being, and it gives staff valuable experience in helping the wider community. A subgroup of health and well-being network will be established, led by Carwyn Lloyd-Jones, with support from Claire Hereen and the People and OD team. And we are already in discussion with Claire on how we can use the digital champions to work with her on digital inclusion projects. For Pledge 4, through digital inclusion surveys and the NHS Wales app, we can help to signpost and support patients and the public. We recognise not everyone has access to broadband or devices or feels comfortable in using digital on their own, so we want to help people find their closest support using the NHS Wales app as a resource. The first survey, which is available by QR code in existing survey software, was launched on the 15th of June, and paper copies will be available shortly. The survey responses will link people to sources in their local areas, such as public libraries, health boards and trusts, etc., through the Map of Wales directory of digital inclusion. We will run the surveys for a year with at least quarterly reviews and findings. We intend to develop 2 other digital inclusion surveys to find out if there are other networks in NHS Wales and third sector organisations that we can collaborate with to be digital champions and find those staff who need support. The NHS Wales surveys can support the digital capabilities tool, while we think the same would be useful for third sector organisations to work with us. We will be creating a communications plan, updating our website and intranet to include public-facing information and give a 10 talk to DHCW staff in the autumn. Next slide, please. As a National Digital Lead for Public Engagement, I'm a member of the Patient Information Forum Advisory Group, Ofcom Communications Consumer Hub for Wales, and the Digital Inclusion Alliance Wales Network, which is really important for me to be able to share information and gain advice among organisations and leads across the UK. DSPP is building the NHS Wales app with support from the Patients and Public Assurance Group to ensure that digital inclusion principles are at every stage of development, from discovery to beta to live production, and through user research with people with different skills, ability and disability, sensory lots, diversity, equity and condition-specific requirements, as well as Welsh language, to build confidence in using digital devices. The group worked with third sector organisations, local patient representative groups, and NHS Wales patient experience leads to help us to ensure patients and the public are represented in future developments. This also includes DCW, sensory loss experts, and the health board from Hywel Dda's digital inclusion manager. DHCW's research and innovation group members are developing partnerships across health and academia to share best practice and coordinate activities. We are working with our strategic partnerships, such as the Wales Institute of Digital Information, to develop programmes of work and develop and implement innovative digital programmes. Next slide, please. So the next steps are to get nominations to join the DHCW Digital Inclusion Internal Working Group and identify external partners for an advisory group to ensure appropriate representation. Explore partnership opportunities with the other NHS and commercial organisations. We're also undertaking a mapping exercise of best practice of digital inclusion projects in Wales and beyond, and evaluate findings from the digital inclusion surveys of patients and the public. Very keen that we can use our digital champions for community volunteering, and we also intend to brief and update relevant networks such as the Directors of Digital and independent members' digital networks and health boards and trusts. And finally, of course, submit the accreditation plan to DCW. It is a really exciting time for DHCW to be involved in digital inclusion, especially at the beginning of the rollout of the NHS Wales app, to see how we can help the people of Wales become more digitally included and how we can support service transformation. Thank you for listening.
Thank you very much, Sarah and Joe. There's a lot in there. I've got a couple of questions, but I, as ever, will go follow up at the end. Anyone want to raise any questions, make any comments at this stage? Perhaps if not, I'll go on, Ivan.
Diolch, Cadeirydd. So we just sôn yn gyflym am y profiad o yr ymateb i'r pandemig ac yn arbennig yr proximity app COVID-19, achos fi'n credu bod e'n amlygu safbwynt polisi digidol yng Nghymru, sydd yn dipyn bach yn wahanol i'r safbwynt polisi yn Lloegr. Ac yn benodol, ar yr app roedd na nodwedd check-in, QR code check-in. Ac yn Lloegr, roedd na fandad oddi wrth y Llywodraeth yn mynnu defnyddio y dull digidol hynny fel ffordd o yrru bobl tuag at yr app digidol a'r dulliau digidol o weithredu. Yn fwriadol, doedd na ddim ffordd analog neu ffordd papur yn Lloegr, ond oedd gweinidogion yng Nghymru yn glir iawn bod nhw eisiau polisi gwahanol. Felly wnaethon ni cadw'r dulliau analog, cadw'r dulliau offline, a cynnig y dulliau digidol. A dwi'n meddwl mai dyna yn dal i bod yw'r polisi sydd gyda ni. Wrth gwrs felly, i ni eisiau buddsoddi yn y gwaith digidol i wneud pethau mor gyfleus a phosib i bobl. Ond dydy hynna ddim yn meddwl bod ni yn mynd i gau neu dod i ben a'r dulliau analog sydd yna hefyd. Felly mae'n dulliau digidol ni, a'n sianelau digidol ni yn ychwanegol, nid yn lle y dulliau analog. A fi'n credu bod hynna'n bwysig yng Nghymru oherwydd y sefyllfa wahanol sydd gyda ni o ran ein poblogaeth, a llawer iawn o bobl yn byw mewn ardaloedd gwledig ac yn yma a hynny.
Can I suggest, Joe and Sarah, that we pick up a few and then I'll invite you in to make any comments at that point rather than after everyone, if that tends to work a bit better. Marion.
Diolch Cadeirydd, a diolch i Joanna a Sarah am yr cyflwyniad hynod ddiddorol yna. A mae'n gylondi gweld gymaint o weithgarwch yn y maes pwysig yma. Mi oeddech chi'n cyfeirio at yr argyfwng costau byw, a da ni gyd yn gwybod pa mor fyw ydy hwnna yn nifer fawr o'n cymunedau ni. A mae'n dda gweld trafod gyda phartneriaethau masnachol i helpu i fynd i'r afel ar broblem yma. Ond nes bod ni'n gallu mynd i'r afel efo tlodi'n rhai o'n cymunedau, mae'n ymddangos i mi bod hon yn broblem fawr. Ac cwestiwn sydd gen i ba raddau i ni'n mynd i edrych ydy hwnt i wledydd Prydain a'r arfer gorau yng ngweddill Ewrop ac yng ngweddill y byd falle o ran sut mae datrys y problemau yma ac sicrhau bod pawb yn cael mynediad i'n gwasanaethau digidol. Diolch.
Thank you, Marion. Marilyn, and then I'll ask, perhaps at that point, ask you, Joe and Sarah, if you want to pick up on any of the points made. Marilyn.
Thank you. A really lovely report, Joanna and Sarah. I'm really enthused about it. I just wondered on the point you made that you talked about hopefully getting involvement on the community initiative side. I was just wondering about the prompt approach we take in. Would we be going to overarching organisations and asking them and sort of engaging in that way? Or would we have a few methods, or would we be going out to the general public and telling them and perhaps holding surgeries? I'm just wondering what sort of approach, or are we going to use various approaches?
Okay, Joe, Sarah, who wants to, and then I'll come to you after in a moment, Rowan, who wants to, Joe, it looks like you're itching to kick off.
There are a few things, so hopefully not too difficult, Simon. I'll let Sarah answer the question about the cost of living, because I think that's probably very close to her heart. But yes, there are lots of things that I'm really keen that recognise that people might not have a device. So are there places that like the Good Things Foundation and public libraries where they do have computers and support there that can help people? So yes, again, and yes, I agree with Ivan that we're not getting rid of the analog versions of things. This is just really is to support people and open up those channels for people who probably would be stuck really with the analog version. So let's make this as easy as possible for people. Marilyn, I think there's lots of things going on. I think it is a mixture of working with organisations as well. As I said, we've got some work doing with the STEM pet membership, and also the Prince's Trust. I think there's a programme that we've signed up to as well to get our staff involved in that. But definitely with the work I'm trying to do with patients and public, we're working very closely with third sector organisations and the NHS Wales staff to make sure that we can all work together in helping people. So surgeries and pop-ups would be brilliant to be able to provide those as well. Well, let's Sarah answer the one about cost of living. I'm sure you're aware the House of Lords just published their report around cost of living crisis and its impact on digital exclusion, calling on the UK government to create their digital inclusion strategy is, I think, over 10 years old now. So they're talking about working on it more effectively. As a programme, Digital Communities Wales, we work closely with Scotland and partners in England like Good Things Foundation, who run the National Data Bank and the National Device Bank. We also talk to telecoms providers about their social tariffs, and we're working with Welsh Government to promote the awareness of social tariffs more effectively. In terms of looking, I think you asked about looking sort of further afield. We are trying to keep aware of things going on in different areas. I think Estonia
has just launched some really interesting work. So we're trying to create those alliances, and yeah, we are always looking to learn from what others are doing. I think the cost of living crisis is very internally focused. Sometimes we're all sort of suffering from it. It's all happening right now in front of us. But we do try and look abroad and see what else is going on.
Thank you. Now, I'm having a very interesting time here. We've all had a Zoom upgrade, which appears to be going to good old-fashioned chivalry, because every time a woman puts up their hand, you're getting bounced down further down the line, Andrew. So I'm having to remember. So it's Rowan, and then Andrew, and then Helen.
Yeah.
Thank you, Simon. So I think this is probably one of the most important topics that we face in order to actually meet our ambitions of a healthier Wales. I was reminded in a discussion a week ago by Rydian that the goal of prudent healthcare, which is how we deliver healthcare in Wales, requires us to enable clinicians and patients essentially to co-create their own health. And I was struck by, as I'm sure many people on the board and perhaps listening in, we have elderly parents, and my mother had exactly one of those conversations with her GP recently, and her default response was to say, well, I have to rely on the guidance of my clinician to advise me on what's best for me, and that is a deeply ingrained culture, right, which has been built up over decades of a sort of paternalistic care system, which was how historically we delivered care, and how we engage the public and patients to think about being owners of their own health and responsible for their own health has at its heart a requirement to be digitally included. And I think that's important, because we have to respect individuals' choice not to use digital services. That's always should be open to people, and we need to support them. But equally, I think we have to also recognize that supporting inclusion where people want to get online, and also perhaps speaking to the benefits of being included. I'm always kind of struck by a couple of examples, which I'm just going to share here, which is firstly sort of financial benefit. So I had the opportunity to work with an entrepreneur running a company called Hive Online, and Hive Online is a financial tool which is delivered to farmers in Africa, and farmers in Africa are usually female, they're subsistence farmers, and generally you can assume that they are illiterate, and yet they were delivering a digital service on not even smartphones that allowed these women to check market prices, and resulted in them having the opportunity to maximize their income at market when they were walking products to the marketplace, which was transformational. It was the difference that allowed them to send their children to school. So I always kind of start there, because I think that's the absolute example of it is possible. But I also think, the individual piece about enabling people to be members of their community. I used to have an elderly neighbour in her 80s who used to run an ironing service, and I hope you're not all going to help the ages that there was a lady of 80 running an ironing service. I want to say that was her choice. It wasn't under duress. But I was struck, even back in sort of 2007, 2008, an email used to pop into my inbox with Rowan, your ironing's ready for collection, and this is your bill sent from my Apple Mac. And I just think it's important that we don't play to stereotypes about what is possible, and I think there are ways through this, and I'm keen that we find solutions and also that we set targets, because we don't actually progress without them. So I guess my question to Sarah and Joanne is whilst I recognise the problem, do we have any targets set to drive inclusion and support those who want to get online?
We'll do the same, Joe. Sarah, should we just pick up a few comments and then come back to you? Andrew, it's definitely you next.
I mean, you'd be relieved to hear I haven't got any questions, but I'm just going to say there's a lot of points very well made by board members. A lot of people have said things that I was going to cover. It's just really to give support for the work that's being done. I know I've had some professional involvement in some of this work, and it really is a really exciting time. And given the development of the NHS Wales app in Wales, and our ambition to for this to be the digital gateway for access to digital services, this really is quite timely. I was just going to say that it's not only developing the digital competence, but ensure people can access the digital services. And Marianne earlier raised the point that poverty can be a contributor, and thank you to Sarah for addressing that question. And then Rowan raised my next point about just not. I think it's really important we don't lose those members of the public that choose not to interact digitally, because a lot of people will not be engaging digitally, and I know certainly it's one of the considerations I have professionally when we look at something digitally, to make sure that there's always the other process is always in place, you know. But it was just to say it's all really important stuff, and it is really welcomed, and just to offer my support.
Thanks, Andrew. Helen.
I wonder if you want to bring Sarah in on the targets question from Rowan, and then I've got some final comments, Chair, if that's okay.
No, I've got some final comments.
Oh yeah, okay.
Go on then, Sarah.
I might not speak directly to what DHCW's targets might be in this area. I'm sure Joe can do that. But one of the things you mentioned about ingrained behaviour, what we do when we train champions and digital champions is that we teach them about the hook. So you don't go to a person who's digitally excluded and say, we want you to take over your health, you know, your care and take ownership of it. You say, would you like to talk to your sister who lives in Australia? Or wouldn't you like to know where the pharmacy near you, you know, whether your pharmacy, find the thing, the one little thing that they find useful and that they are happy to do. You teach them how to do that. And slowly but surely, as they gain that confidence of their digital journey, they can gain more confidence in terms of their health journey at the same time. So it's that little hook that they find, oh, that is useful. Oh, okay. Well, what else can you do? And it's sort of, that's the way to build them up to it, rather than sort of throwing the whole boat at them. Here, take over your health. You know, it's never gonna work like that. And I like the point you made as well about the stereotypes. There's a lot of sort of the idea that all older people are excluded and all young people are digital natives. And that's very wrong. In terms of the Public Health Wales just released their report about how people use digital tools to look at their health. And there are, not surprising to me because I know about it, but a lot of older people are happily online. But there are also a lot of younger people who they've got a smartphone, they know how to go on TikTok and post videos to YouTube and do all sorts of things that maybe other people might not be able to do. But in terms of those 5 essential digital skills, they might not be doing different things online. They might not be able to make PowerPoints and look at Excel spreadsheets or any of those sorts of things. So it's about not falling into those stereotypes and looking at what the individual needs in order to get them to take ownership of that journey.
Yeah, on that last point, Sarah, we had some very interesting things described to us at the Digital Summit we held last year around the use of a digital application can be just as confusing if it's not designed right for a young person as it can be for anyone else. I just want one question, because we've obviously had a great, and it's been fantastic, a great description of what we're doing. And then picking up on Ivan's point, really, which is around the analog staying on with the digital. A lot of what will be achieved around digital inclusion, ensuring that no one's left out, is our partners doing it, and not us doing it, because it's not within our gift, if you like, to do something. So I'm wondering, but what is within our sphere of influence is to encourage others to get on the bus, if you like, on this. I'd be interested to know where you are in terms of the wider NHS system around how signed up they are to this agenda, to these issues, and also organisations associated with the NHS. And then what I'm thinking of is SLICE, the new citizen voice body, is how much they, you feel that they are engaged, because unless we're all involved in this as a whole system, we're not gonna, we don't have a chance of achieving it, because we're one little bit in the wider cogs, if you like.
Yeah, I can answer that. The SLICE are a member of our Patients and Public Assurance group. Simon said, yeah, we work very closely with them, and other organisations as well. I think it is interesting. I think there's just one digital inclusion manager in NHS Wales, which is at Hywel Dda. They've really sort of taken taken that forward, and I think it would be great if they had digital inclusion managers across the whole of Wales as well to work with us. And I think, yes, there's a lot more, I think, from service transformation. It's very interesting, Rowan's comment about the paternalistic. I don't know how it's about us changing a culture. And I think, as Ivan said about through COVID, it was very interesting how quickly health and care professionals actually took on board digital, rather than saying, no, we've got to do it face to face. And actually, I think that was the biggest change for me. I think rather than it just being patients and the public using digital, we actually were seeing a change in actually health and care professionals taking on that as well.
I'd also just say that, Digital Communities Wales has been working in wards and in services and at a sort of on the ground level for a long time, but it has been harder to get up to the higher levels and to get into the boardrooms of health boards across Wales. But as Joe said, Hywel Dda have Anthony Tracy, and I think ABU just hired a new director of digital, and he's meeting with Digital Communities Wales and was asking about the charter. So that's, I feel the progress in health, and yeah. The more, as you said, Simon, the more you can sort of fly the flag and say DHCW is doing this, and be the representation that we want all the health boards to be like, and what we want everyone doing. And Betsy as well, they have a new strategy, digital strategy with digital inclusion sort of woven all through it. So yeah, we are seeing those moves happening, but appreciate any time you can in your boardrooms and in your meetings that you bring this up.
Let's have a conversation with this, Sarah, because I'm thinking that using our various peer networks, the chairs network, the vice chairs network, the chief executives, the digital independent member network, I don't see any reason why we can't be asking in those networks for a slot around digital inclusion, because it's so critical to the future, certainly as we try and identify more and more digital services to help the NHS run more efficiently and effectively, and better access for patients. So we'll have a conversation about how we can, how do we put it, shoo you into various fora that would be helpful. Helen, you wanted to come back on a few points.
Yeah, no, great, and thank you everyone for all the great comments and questions in this space. I think, just to kind of set out that we're on the beginning of this journey. I think we've done some great work with the support from Sarah and the team at Digital Communities Wales and through the Alliance and the work that Joe has been doing. But I very much see this, that we're at the beginning. So we've signed the charter. We've started our translation of the charter into our action plan. We've got a lot more work to do in this space. I think it's really exciting. I think that there's an opportunity for us to step into a leadership position and support and facilitate colleagues and partners across Wales in terms of this agenda. So I think there's quite a lot that we can do to support health boards and trusts in terms of translating the pledges in the Charter into kind of actions that really do make a difference. I'm really keen that the community initiative projects that we're starting to frame and that we'll talk in a bit more detail to the board about in future really gives our staff a chance to really get involved out in communities. So we've got to really work out what that looks like, what that means, and how that then furthers this agenda, given, you know, the challenges that are there. You know, the worst outcomes for some of the work that we do is that we kind of, you know, add to the inequity that already exists, and, you know, and succumb to the inverse care law. That we've got to be alive to that and make sure that we are supporting accessibility and equality of access to services. And as Rowan reminds us, you know, the absolute kind of principles of the prudent healthcare policy that we have in Wales. I think there's something about, for us, we've got European networks as well, so it's not just in digital inclusion, but in health informatics, is using and engaging in those networks, which myself and Eve definitely have been doing over the last year or so, really, in terms of understanding what other countries are doing and how then we can step into that. And yeah, really the target bit for me, I think we've not set targets or got into that kind of in terms of our mindset yet, Rowan. I think that the priority has got to be to get the action plan in place and to bring that to the board, to get the accreditation process started, and work with colleagues across Wales and with Welsh Government then on what are the targets that we should be setting for us as an organisation or for NHS Wales, and to work that through, because your point is well made, is that we need to have some traction in this. But I was going to suggest, Chair, that we bring back an update periodically to the board. So perhaps early next year that we come back and, you know, share with you where we've got to in terms of the action plan and the work on the accreditation, but keep this as something that we want to, you know, continue to share with the board going forward.
Absolutely. Thank you, Helen. I think everyone has had an opportunity to comment. I mean, as people know, I mean, this is so close to my heart, and I've said on a number of occasions when I look back on my time in this role, if I don't see that we've, as an organisation, reached a position where the intended consequence of what we do is inclusion rather than the unintended consequence being exclusion, then I will regard it as being not done what I would have liked to have done. So I can assure you that I'm going to ensure that we keep the foot on the gas on this, Sarah and Joe. I think it's really important that we do, because as you pointed out, we just don't want to live through another inverse care law situation where things get worse for those who most need it. So thank you very much both. As Sarah knows, Compass and the work of Compass, or as I knew it, Wales Cooperative Centre, very close to my heart, and it's great to see that the work you're doing in this field, which kicked off after my tenure there, but I was very much aware of it. So thank you both, Joe, and thank you, Sarah.
Thank you very much.
Thank you.
Great. Lovely. Now, if we move on then to the next item on the agenda, which is my report. There's a couple of, you've got it there in the papers, but there's a couple of few things I'd like to just highlight, and also one thing to add, which has occurred since the report was written and put into the papers. So as you see, I had my annual appraisal with the Minister a couple of weeks ago, and I'm pleased to say that went well. The important thing for the organisation is that my objectives become the organisation's objectives, obviously, and the Minister was had encouraging words for where what we've done in the past year, and also pointed out that we're still a young organisation, and the huge amount of progress we've made in the couple of years, 2 or so years since the organisation was created, she was very appreciative of. 3 things I think she we particularly focused on: the needs to identify sustainable funding routes, processes for the work that we do. That becomes ever more important as programs move from development into business as usual phases. And she's very much aware that we need to address that. Cybersecurity. Some of you may have seen the 2 ambulance trusts in England have had a cyber attack through a third party over the past couple of days. So it remains a very live issue, and ensuring that it remains at the top of the priority list when we come to investment. And then also she's very keen on AI. So I was able to, as you'll see a little bit later in, I'll pick it up, that they're setting up a commission under the auspices of the NHS executive to look at AI and what it might and could achieve in Wales, and where the priorities would be. And I'm pleased to say that on the working group that's looking at that, Ivan and Rowan are representing ourselves as an authority on that working group, and that work will be taken forward over the next 9 months or so, or 12 months or so. So that's the first couple of things, out of the AI item and the my chair appraisal. We just quickly on the ministerial meeting, as you can imagine, the focus is very much on the challenge of the resources available to NHS Wales. I mean, it's a matter of public fact that the collective deficit for this year for that NHS bodies in Wales have identified in their IMTPs is significant and a serious challenge. So the Minister is very much focused on how we address that, and whilst ensuring that we don't impact on care, particularly care for those people who already perhaps don't receive the optimum care. That takes us back to the inverse care law issue, doesn't it? And then the final thing I'd like to highlight before I come on to the bit that's occurred since the report was written, is the cybersecurity webinar that we ran. And you always enter into these things with a certain amount of trepidation in terms of how many people will attend after you've put them together. But we had well over 100 board members, NHS board members at that webinar looking at cybersecurity, where we heard from someone from Ireland describing the issue of the major cyber attack they had in Ireland and the implications for that, and also someone, a consultant psychiatrist who has an NHS England role, telling us about the consequences of the advanced cybersecurity cyber attack, which obviously impacted us on the 111 issue, but much more significantly in England. And what I think the key message for me that came out of that is that, yes, cybersecurity, investment in cybersecurity is an issue of kit and infrastructure, but ultimately it's a patient safety issue. And some of the key messages that came out from Ireland and from the consultant psychiatrist was not having access to records, not having access to information directly and immediately became a patient safety issue. And for example, the individual from Ireland describing how surgeons were flying blind. They just didn't have any information, which is obviously a huge, and the number of near misses. Fortunately, there were no serious consequences, but probably more by luck than design in many senses. So I think I'm very keen in the conversations I have with colleagues across Wales, NHS chair colleagues, is to say, look, you really ought to be looking at this as a patient safety issue as well as a kit and infrastructure issue. So those are the things I wanted to draw out from the written report. The issue that we've reached a conclusion on, people be aware that we commissioned a program governance review, which was independently undertaken by Steve Coombe, who was a now retired board secretary from Swansea, and he presented that report to ourselves and the Welsh Government. And recently, a couple of weeks ago, Helen and myself met with the Minister and the Chief Digital Officer for the Welsh Government to discuss the recommendations and the conclusions of that report. And I'm pleased to say that the Welsh Government and us have agreed that we will adopt the recommendations of that report almost in full, and that there will be revised programme governance arrangements coming into play over the next, up till the end of this financial year. And the Welsh Government have informed programmes of that very recently, that this programme governance changes is occurring. I think it makes all sorts of sense, and it makes a lot of things easier and clearer in terms of how we prioritise, how we ensure that we're using effective use of our resources, and then critically how we apply the appropriate levels of scrutiny and assurance as an independent, accountable health authority to major programs that are being delivered. There will be a need to look at our governance arrangements and how that works and how that changes and what needs to be put in place. And the intention is to bring a formal paper to the September board meeting, which will set out the suggested approach that we take, because obviously we'll need a discussion around that, and the board will need to sign off. We'll need to sign off those arrangements. So those are the things I wanted to bring to you. Oh, and I think for me, I would say I think this is a really positive step and a really important step for the organisation. As I pointed out, we're only just over 2 years old. I think this is an important step in the maturity and development of the organisation going forward. So if anyone's got any comments or questions on any of the points I've raised, please raise your hand. If not, I will hand over to Ruth to ask her if she has anything she particularly wants to pick out from her section on the report. Doesn't look like there is, Ruth, so over to you.
Nothing further to add from me, Simon. Thank you.
Thank you, Ruth. Okay, everyone. Oh, there's one further thing, because Chris will jump in and say you haven't done it if I don't remember to do it. You are being asked in my report to endorse the use of the common seal as was set out in my report in a deed between ourselves and Citadel. People happy to endorse the... It was very exciting, wasn't it, Claire? Okay, so now we move on to the report of the Chief Executive. Helen, I'll hand over to you.
Diolch, Chair. Yeah, I'm very disappointed to miss the use of the common seal, but yes, hopefully that, well, maybe there'll be a next time. So just a couple of things to pick up from me, from my report. Colleagues will have had the chance to read it. So just draw out that we've now received, on the 5th of July, we received the report from the Joint Senate Committee into DHCW that happened last October. So we are working through the recommendations that are set out from the Joint Committee report. There are 16 recommendations, some for Welsh Government, some for us and Welsh Government, and some for us. So we're working through that at the moment. And we're really pleased, actually, that we've got the report, and pleased that the report was highlighting the progress that we've made. And, you know, in terms of our mirroring, actually, the feedback that we had for the Minister, you know, we're still a young organisation. So having, you know, been in operation for 2 years, the progress we've made was acknowledged. So that's really helpful. Also recognising that there are still challenges, and, you know, there's a major agenda for us in terms of the digital transformation across health and care in Wales, and asking for some more information on that. So we're working that through, and of course we'll keep the board briefed on the response as that develops. I was also asked to provide a witness statement, as were all chief executives across NHS Wales, to the module 2B of the COVID-19 inquiry, the UK COVID-19 inquiry. The module was looking at government decision making, and 2B is the focus on Wales and Welsh Government decision making. So I submitted my my response, as did many of the chief executives. I think some have still to submit those and had an extension, but ours went in as per the deadline, with quite a lot of detail, actually, that was asked for. I do anticipate that we will have further requests for a Rule 9, as they call it, witness statement, when the inquiry moves into module 3 later this year. So again, I will keep the board updated. And we've also had our joint executive team meeting with Judith Pageant, the Chief Executive of NHS Wales, and her team. Really positive discussion across all of the areas as we've set out in the report, and reflecting back on last year and a forward look to this year, recognising some of the significant financial challenges that the NHS is currently facing. and the context of that for DHCW and where we've been. So you'll be aware, colleagues, that we've submitted an annual plan that balances this year, but our 3-year IMTP is not a balanced position. But we are working through that with Welsh Government and working on kind of the delivery of our annual plan. And Claire will touch on a bit more, I think, when she talks about the finances in terms of where the current kind of NHS context is with that. But just to say that the feedback from the discussions was really positive at our JET meeting. And then finally from me, it was really great to attend the graduation of the Change Ambassador ambassadors, actually the program that we ran in DHCW, and it was quite heartening. Actually, it's not just the digital teams out there that are participating in this. We've got participants of the program, therefore qualified now change ambassadors right across the disciplines in the NHS in Wales, so that we can start to really grow the cadre of change champions out there. So really pleased with the success that we're seeing through the Change Ambassador programme, and recognising the huge importance that having people on the ground in their services, in their departments, in supporting and recognising how they can support and influence all of their colleagues in terms of adopting new ways of working and embracing digital change. So really well done to Harriet Stone and her team for taking that forward so successfully with our partners in the Wales Institute for Digital Information. That was it from me, Chair. Happy to take any questions.
Thank you. Is anyone any questions or comments rising from Helen's report? No. Okay, thank you very much, Helen. We'll move on to part 5 of the agenda, strategic items. And the first, and we're welcoming Michelle. Has Michelle joined us? Hi, Michelle. The strategic procurement report, and Ivan, if you'd like to introduce this item.
Diolch yn fawr iawn, Simon. Fel arfer ar gyfer yr eitem hon, does dim rhagor I fi wneud heblaw cyflwyno Michelle. Felly, rwy'n cyflwyno Michelle I arwennu trwy'r eitem.
Thank you, Ivan. Thank you, Chair. Good morning. So I've got one contract that I'm presenting today for the approval of the board to move to award. The detail is in the papers, so as usual, I'll just pull out some of the key points perhaps, and then happy to take any questions. So the contract relates to Net Backup and Backup Exec. So these are software products, a core part of our infrastructure that we use to back up and restore services in the event that that's required. And we've actually been using this particular product for a number of years now. I think 2010 was when we introduced this. The product is developed by a company called Veritas, and the proposed contract award is to Computer Centre. Computer Centre are effectively a software reseller who we're proposing to contract with. So the contract is a software subscription. So we're moving away perhaps from a more traditional license model to a subscription. Again, that tends to be our direction of travel now in terms of the way we're deploying services. There are other services that come with it in terms of maintenance support, technical consultancy, which is potentially quite helpful to the team in terms of the use of the product. And there are some optional aspects in the contract as well. So the contract value as published is a maximum value. The core cost within that is about 875,000 over the term, and the rest of the amount relates to the optional products. So should we wish to call those off, that indicates the maximum expenditure that we would expect. So it's a 3-year contract. As I said, we ran a competition under a Welsh Public Sector Framework Agreement in order to secure this requirement. We're proposing to award to Computer Centre. Again, we have a number of agreements as an organisation with Computer Centre, very reliable, a good relationship effectively as resellers of other third-party products generally. The contract will start for the 31st of July, and because it's a Welsh Public Sector Framework Agreement, we are not required to specifically separately notify Welsh Government of our intention to enter into the contract. So subject to the approval of the board today, then we can move to execute the agreement.
Thank you, Michelle. Does anyone have any question? David.
Thanks, Simon. Thanks, Michelle. I fully support the decision to award the contract. I just had a query. I think I read in the paper that it says there's no option to support beyond 3 years, and noting the age of the product, 2010 we introduced it. Is that now because it's getting towards the end of its life and when it comes up for renewal, we'll probably have to look for an alternative?
No, I'd probably look to, if we're going to get very technical, I'd probably pass over to Sam. I have to be totally honest, David. So there's preparation, 2-minute warning. But no, sorry, that's probably my clumsy explanation. As I say, this is the current version of the product as I use it. There are some enhancements in this version of the product as noted in the paper. It's 3 years because that's the span that we've put on the procurement. So I should imagine, Sam, during that period, we may be looking at whether that's the product we want to use going forward. I don't think it's because it's an end of life or kind of older product, but I don't know, Sam, if you wanted to comment on that at all.
Yeah, thanks, Michelle. That's correct. It's the current version, but it's yeah, so it's the procurement or commercial rules that put us into this no extension position, but it's not to do with the obsolescence of the product. And we're obviously looking at backup strategy in terms of what that means as we move much more to cloud and move away from on-prem and data centers and tape libraries and so on. So we'll be looking at the strategy in this space over the next 3 years.
Thank you both for that explanation. If there's no other questions or comments, can I ask the board if they're happy to, may I ask the board if they're happy to approve this procurement? Thank you very much indeed. And Sam, you're back on. So with item 5.2, Sam Lloyd is going to give us an update on our product approach. Over to you, Sam.
Thank you, Chair. I think there's some slides coming up. Yeah, thank you, Hannah. So this is a quick update on progress against the adoption of the product-centric operating model. As I've set out a couple of times, this is going to be quite a major undertaking. It's a multi-stranded piece of work that includes structures, ways of working, technology infrastructure, workforce skills and capabilities, and we'll be looking to evolve those in lockstep over a period of probably 3 years. So we're in a fairly early kind of discovery and startup phase at the moment, but there are some specific pieces of progress that are being made and specific activities underway currently, which I would like to update the board on. So if we could move to the next slide, please. The two specific items that I'm just going to touch on briefly today are the Operations Directorate structure. So as part of the work on product-centric operating model adoption, I'm looking at really what skills and capabilities need to be in place within the Operations Directorate and where we've got gaps at the moment or where we've got portfolios that need to be strengthened. And then there are some external engagements that we're in the process of commissioning that will help to shape up the next stages of this activity in a bit more detail. Next slide, please. So as everyone will be aware, the Operations Directorate consists of two former directorates which were merged. So we had the ICT Directorate, which is essentially traditional IT infrastructure, cybersecurity, client services, desktop support, networks, data centers, etc. And then application development and support, which is more focused on the line of business applications that we develop and provide out to the wider system. The structures that we are operating at the moment within the directorate still very much reflect that legacy. So this is about looking at what do we need in the longer term and how do we evolve the directorate structure in that direction. Next slide, please. So to that end, we've come up with a new directorate structure which looks at addressing, strengthening key areas, future-proofing us in terms of what's the technical and capability development of travel across our areas and where have we got gaps that we need to bridge and fill. So the new structure looks very much like this. I'll talk through what the portfolios mean in a bit more detail on the next slide, but really just to highlight that at this point we're in the process of launching a consultation, so that's out at the moment. This structure has been published to the whole organisation. In fact, it's been discussed with staff side. The consultation is underway and is due to finish next week, so we're inviting comments on this. We're very much looking at this in terms of a first phase, which is to establish the Operations Directorate senior leadership team. And then once that first phase is complete, there'll then be a period of looking at further structural changes, which will be required to strengthen and develop the new portfolios and to make sure that responsibilities are in the right place. There is a mixture of new posts here and some minor changes to existing posts. And of course, those people who are impacted of conversations have been had directly with them. Next slide, please. So I won't go through all of these in detail, but this is a summary of the new portfolios that are being established in the Operations Directorate. So moving quickly from left to right, I'm establishing an Associate Director of Digital Delivery post. So this is really about providing that leadership for the definition, prioritization, assurance and reporting of the operations portfolio. We've got a bit of a gap in this space at the moment. So this is about how we manage incoming demand to the directorate, how we manage resource requirements across the teams, how we identify dependencies, really critically as well, how we integrate with the strategy and delivery function in the EVAN leads, and making sure that the central PMO that's being set up in that area is joined up very closely with the operational delivery teams. The next role is a Chief DevOps Officer. So this is going to be really leading the execution of the product strategy. So the individual product groups, product lines and product teams will report up into this Chief DevOps Officer. And this role is going to have responsibility for leading and developing our software engineering capability and making sure that we're driving out the right levels of performance and efficiency across that space. And we're really looking at modern development practices, continuous integration, continuous deployment, automated testing, and so on, and making sure we're able to measure and report on that and improve performance accordingly. The next role is a Chief Digital Architect. So we've got a range of architecture roles across the Operations Directorate, but they don't come together into a single capability. It's important to make a distinction here that there's digital and technology architecture that will sit within operations, and data architecture will sit within EVAN's area, and those two architecture roles will clearly come together to create the whole DDAT architecture capability. But this is really about taking a step back from how we manage our individual products and thinking about what does the overall product landscape look like, and how do we make sure that we involve that in a common direction, and how do we understand what the future roadmap for our systems are at that kind of higher level. Also in the process of setting up a technical design authority, which obviously this Chief Digital Architect will play a key role in. And the intention is also that that design authority will potentially become a national capability subject to a successful deployment within the HCW initially. Chief Information Security Officer. So I think cyber is such a critical responsibility for us and such a key part of our national capability that role needs to be elevated to SLT position within operations. There's a lot of strategic national activity that goes on in that space, so it needs to be represented at the right level. The Infrastructure Director role will look after the data centers, will be responsible for the cloud strategy and driving the adoption of cloud native architectures, and making sure that we've got a single infrastructure and way of working that can be, as far as possible, consistent across all of our cloud platforms and across our on-premise infrastructure as well. Running the Centre of Excellence, of course, and then managing the client services and other support structures, which are obviously an important part of our service portfolio. Directorate Management, this is really just about the running of the Operations Directorate business, keeping us safe and on the straight and narrow, making sure that we've got control of our finances, recruitment, managing performance, and so on. And then lastly is the Associate Director of Enterprise Service Management. So as of the 1st of July, service management transitioned from the Finance and Assurance Directorate into operations, and I think that's a really important synergy to help ensure that the product teams have got the right engagement externally, so that we can prioritize backlogs with our stakeholders, so that we can manage operational delivery across all of our different portfolios. We can manage incidents and deal with major incidents effectively. And I think it's really important that service management supports the rapid delivery of product capabilities. So there's work to be done in shaping that up, but I think it's important that we establish that as a top level portfolio within operations. And as part of that, the service desk will move from the client services area into this new service management capability, so that we'll have a single integrated service function. Next slide, please. And then this is just a reminder of the kind of high level concept that we've been working to. And this also just to illustrate that the structure that I've just been talking through is absolutely aligned with this and is really a key part of implementing it. So the product groups will sit within the DevOps and infrastructure director areas, and then enterprise architecture, service management, portfolio management, and DevOps as a discipline sit as supporting practices. I'll talk a little bit more about the work that we're going to do to bring in somebody to help us shape up this in a bit more detail shortly. Next slide, please. This is the consultation timeline. We are on a fairly tight timeline here, so we've got quite a bit of work to do to get this moving, but it really is critical, I think, that we establish the SLT within Ops as quickly as possible. So we've given ourselves an intentionally quite challenging set of dates here, but ideally we'd like to be interviewing by the end of August. I think that is looking like it's going to slip a little bit, but I certainly want to be interviewing as far as possible within September, because this is critical for me. Okay, next one, please. Again, a quick reminder of where this sits in the overall plan. So there are pieces of work which I'm about to talk to, which constitute a set of discovery activities, which are then going to inform the wider roadmap in terms of how we move forward and adopt product centricity and embed that across the organization, and fully expecting that to take at least 3 years as a full exercise. Next slide, please. So to come on to the specific work packages which we're in the process of procuring, which will help us to move this work forward. So one of which is to help us design the product operating model. So that work is really going to help us identify what are our product groups and work streams, and then what product teams constitute will come together to make up each product group. But I think increasingly more than that, it's about really understanding all of the different touch points of the product-centric operating model across the organization, because it's important, it's clear to me now, having been here for 6 months, that things like clinical, has a huge impact on how we, how our products are designed. So we need to embed clinical practice into the product-centric operating model. Service management, I've already talked about, strengthening the relationships with our external partners through the service management boards, or however we choose to do that in the future. So it really is looking at how we work across the whole organization and helping us to build that into an operating model that's coherent and consistent. So bringing in some external expertise for probably a 2 to 3 month engagement to work that up. DevOps maturity assessment. So this one is literally about to be procured this week or next week. This is going to be key in terms of understanding how we move our software engineering capability forward, which for me is really important in terms of, adding that value to our stakeholders, because we need to be delivering the requirements that they're requesting of us as quickly as possible. And really that is DevOps at its heart. That's what it's all about. So we're bringing in an organization to look at, or to look across 10 of our products and 5 of our platforms and do a very high level maturity assessment across that space, and then to drop into 3 high profile critical areas in a lot more detail. So those will be WPAS, WCP, and our integration services, all of which are strategic, all of which are under significant pressure at the moment. And it's really about looking at what technology stacks are in place, what development practices are in place, what development tool sets are in place, what skills we have, what cultural readiness we might have across that, in terms of moving to a different way of working. It's going to come up with a set of activities that we can then work towards over the course of the next year or so to try and develop and move forward. And there are 3 focuses for this. So it's about cost reduction, or certainly efficiency. So how can we be as efficient as we can be within the envelope that we've got? And obviously this is coming to the fore increasingly with the wider financial situation. Speed, so how quickly can we deliver that additional capability, and quality, so how can we improve the reliability of our services, and how can we make sure that systems are built to appropriate quality standards. Next slide, please. And just these are the last two work packages. So looking at WPAS from a cloud readiness perspective in a bit more detail. So there's quite a lot of conversations going on at the moment in the PAS space around, what is the strategic direction of travel here? Should we be looking at EPR or EHR? So we need to look specifically at WPAS to understand what is its technical architecture, what opportunities might there be to improve that? Could we move it much more into a cloud native application? Does that provide opportunities for centralization and consolidation onto a single platform? How does that support the wider cloud migration? How does it support the DevOps maturity work that we were just talking about? What would the costs of moving it to the cloud be? So it's really sort of taking one of our biggest and most complex systems as an initial, and tackling that first, really picking a difficult one and trying to get underneath what that would look like. And then the last one is a smaller exercise, but this is really about validating the outputs of the work that's currently underway with Microsoft to build a cloud total cost of ownership model for us. So we're deploying tooling across our estate at the moment, which will help us to understand what the cost of potentially moving services to the cloud might look like, how that pans out over a multi-year period. But it's important, I think, to get an external view on that and to validate that information and to just help us apply a bit of wider industry understanding to it. So it's just to help us build the business case. Thank you. And then my final slide is on software delivery performance. So I've mentioned a couple of times that we're starting to produce some metrics around our software engineering, and really this is looking at a couple of four key areas, which are the industry standard ways of measuring software performance at a high level. So it's lead time. So how quickly can we deliver a new requirement through from conception to production? Deployment frequency is how often are we doing that? So how much value are we creating in a given period of time? Time to restore, if a code deployment goes wrong, how long does it take us to recover? And then the change fail rate is how often do those deployments go wrong and need to be rolled back. So we're looking at this in the spirit of continual improvement. I think some of the performance statistics look quite low on the surface, but really what this is saying that actually our environment is really quite stable. So our time to restores are low, change failure rates are low, but what we are seeing is that the lead times and the deployment frequencies are quite high. So we're not deploying very often, and often it takes quite a long time for something to be transitioned from conception through to development. So we've got some clear opportunities for improvement here, and that's the whole purpose of this, is just to understand where we are and see what we can do to improve. So it's useful already. This is a quite an early view of these metrics, and we'll be looking to build them into the IOPR hopefully from next month. But it's already throwing up some really helpful information, which is going to inform the direction of travel going forward. So that's it from me. It's a bit of a sort of whistle stop through some of the activity that's underway. Hope that was helpful. I'm very happy to take questions. Thank you.
Thank you, Sam. While people are thinking, is the acronym DORA what I understand it to be, demanding of regular attention?
It doesn't actually. I can't remember what DORA does stand for off the top of my head, but it's a standard set of software engineering metrics. Okay. But
no, it's just
I'll find the acronym for you.
There used to be a description of people who were born and brought up before 1948 and after 1948, and Edna was before, which was entirely demanding of nothing at all, and DORA was demanding of regular attention. Rowan, and then David.
Not a question, but just a real endorsement of the approach, Sam, and really good to see, and like how you're picking some of the big, hairy, audacious goals, I think is your language, and just setting out and testing whether the approach will meet some of the big challenges. Wish you every success with that. I think the bit that I'm sure, well, I'll let David ask these questions. So, but well done. Thank you.
Thank you.
Thanks. Sam, really great presentation. Really pleased to see the amount of progress you've made in the last 3 months since we last looked at this. So great to see the DORA metrics. I too don't know what the acronym stands for. I'll have to look that up.
I do know. I'll tell you in a second.
And great, you're going to get some consultancy in to help. Oh, you do? Okay. I do have a couple of questions, if I may. At the previous board development session, we talked about the need to do a bit of a landscape review to work out what we actually want to classify as products, what maybe will stay as an application, what's always discovery, and the product roadmap and the architecture baselining. Are you intending to do that review there, or should we look to see that a bit later on once you've done those two things first? That was my first question. And the second one is, in the paper that you included in the board pack, you highlighted as a key area value definition and measurement, which is going to be key to allowing Claire to help persuade the powers that be to move us to a more sustainable funding model. And can you say anything about when we're looking to get that started? Is that part of discovery, or again, is that something that will follow on from discovery?
Thank you, David. It's DevOps, research and assessment. And on your second point, David, I had something which is in your team matrix. Where would that value work? Which of those individuals does that come into? I assumed it would be the first, the one on the left, but do you want to pick up on David's question, Sam, and then Claire wants to come in?
Yeah, thank you, Chair. So the architecture baselining, David, I think is going to be a slightly separate exercise, and we're actually talking to, we've just started having, Ivan and I have just started having some conversations with the same organisation that worked with another health board to do some architecture baselining exercises. So we're going to potentially look at doing some business capability mapping and then map the technology services and systems that we have to those business capabilities to help us identify where we've got gaps. So I think that'll be our first step, and then bringing in that chief digital architect and working across the broader architecture community, I think will help us build that out over time. And to the second point around value definition and measurement. So this, I think, initially the maturity assessment will help us understand where we can make the biggest value gains in terms of just purely increasing the throughput and removing bottlenecks and increasing delivery performance effectively. So how quickly we can deliver value. I think then the specifics around where the value of each system lies and how that can be improved, I think that's something we're going to have to work on over a bit more time. So I think just acceleration and improving efficiencies is going to produce significant value gains initially, but there's a broader organizational piece, and working with Claire, I think, in terms of what the wider value proposition is.
Thank you, Sam.
Sam, I think there's a similar requirement in terms of NDR and our R&I strategy. So I think it's something that's probably cutting across the organisation. Is if we want to change the funding model, this is probably how we're going to have to do it. It's to get better.
Claire.
And following on from that point, really, I really welcome this. It's going really well to date, and this really sets the direction of travel going forward and helps us really calculate what our requirement is for a sustainable funding model, understanding how the new operating model works, both from a product, but also from a resourcing, and then marrying it through to what does the enterprise going to cost, enables us to really inform the target model and the target financing to support that, complementing that then with a service management that is now really focused on looking at the value and translating that value into a broader set of measures, some of which you've seen, I think will really give us weight in those conversations with Welsh Government as to the future of DHCW's funding model needs to consist of these parts. So I really welcome it. I really support the move with the Service Management Board, and I'm really looking forward actually to seeing some of the outputs of those work packages that will really inform the DHCW plan going forward. So great work, Sam. Thank you.
Thank you, Claire.
Thanks, Claire. Is there anything you wanted to come back on at all, Sam, or?
No, I don't think so. Thank you. Just to say thank you to everyone for the comments and the support. I really appreciate it. I'm very happy to come back and update regularly as this moves forward?
Two things, Sam. I'm sure we'd appreciate that, and it makes all sorts of sense in terms of how important this work is, the changes you're making, and just to echo a number of the comments around how pleasing it is to see progress on this, because we've known that we've needed to crack on for a little while, and with you coming into post, Sam, you've clearly pushed the foot down on the pedal and made progress very quickly, albeit that as this spins out, it's going to spin out over quite a period of time. So well done to you and your team. And I think we're all very appreciative of the work that you've put in to get us to where we are now from where we were when you arrived.
Thank you.
Okay, if we then move on to the last item before we take a break, which is the Shared Listening and Learning Annual Review Report. And I think you're presenting this probably in the place of Sarah Jane, who's given her apologies. Is that right, Chris? So, Chris, you're presenting.
Yeah, thank you, Chair. And yes, I'm presenting this Listening and Learning Annual Review Report on behalf of Ridian, actually. So Ridian's the exec sponsor for all our listening and learning items, and I know he puts considerable thought into ensuring the board hears stories that bring the impact of what DHCW does to life and how it affects clinical staff and helps improve the delivery of patient care. So board members that have been with us since our inception will recall, casting our minds back, in May 2021, we approved and agreed as a board an approach to a shared listening and learning story to start each of our board meetings. So that's been in place for a while now. What we also agreed was that there would be an annual review of the learning themes that have come from that. And the purpose being very much reinforcing the organisation's core purpose through hearing from lived experiences through the listening and learning stories. So section 3.1 of the report just summarises the listening and learning stories that have been presented to the board during 2022-23. And section 3.2 picks out some of the learning themes that Ridian has highlighted during that period. So I'm just going to run through those quickly. Collaboration, clinical leadership, co-design of systems was identified as a key enabler to the success of system rollout, early engagement and evaluation, sustainable funding, and service dependency on DHCW digital systems. So probably no surprises in terms of some of the themes that have been picked out, but that's what Ridian was keen to reinforce in terms of what we've heard from the stories we've had over the last 12 months or so. Wherever possible, our shared listening and learning stories, as was the case today, include members from other partner organisations or staff, clinical staff, recognising DHCW's collaborative way of working and delivery. However, do want to highlight that as an NHS body ourselves that currently provides a very small proportion of citizen-facing services, getting patient and citizen stories into our listening and learning slots for board has been and continues to be a challenge for us. This is an area that we're keeping under close review, particularly with the establishment of CHLICE, the new citizen voice body, which formally came into being on the 1st of April this year, and as DHCW move towards developing more citizen-facing services. I also wanted to just highlight two areas where that have frequently been highlighted through the listening and learning presentations, where we've had exec leads assigned to them over the last few months. So the first one was user-centered design. Sam Hall's been allocated the executive lead for this, and indeed Sam gave a presentation yesterday to the exec team on her initial thoughts around user-centered design within DHCW and what we need to do moving forward. And the second area is digital inclusion. As we heard through today's listening and learning story, Helen's been allocated as the exec lead for digital inclusion for DHCW. And finally, I just wanted to run through section 3.6 of the paper, which is as a board, the listening and learning agenda does feed into our general partnership and engagement approach and how we work. And we've discussed this through our board development work we've had with Deloitte. And this section of the paper just outlines the procedure for external partners and stakeholders joining DHCW board meetings. Any partner may attend by invitation, and any board member may suggest their inclusion on a board agenda. This will be made through myself or Simon as the chair. And if we do have external partners attending, they will be allocated an exec sponsor from DHCW to sponsor that item, as Ridian does for all the listening and learning agenda items that we have to open our board meetings. So I'm just asking the board to note the learning themes and some of the changes that have been enacted over the last 12 months as a result of that, and just approve the arrangements set out in section 3.6.
Thank you very much, Chris. Any questions or comments? And if not, then I mean, I suppose the one it's just keeping our minds open as to the sorts of stories that we hear and getting them as real to the end user of digital services is critical, isn't it? I mean, I know it's difficult, but we need to keep trying to do that. Any questions or comments? If not, then I'll just ask people, board, if they're happy to approve the arrangements that Chris has described in his paper and to us today around engaging with partners at board level. Great, thank you very much. What we will,
Simon, it's gone on mute. So I'm just going to jump in there because I think we're due to take a break now. So we'll take a 10-minute break.
Okay, welcome back, everyone. I return to you with re-downloaded software and new headphones, so hopefully everything will work. And if we move then into part 6 of the agenda and kick off with the Integrated Organisational Performance Report, and Ifan, you'll be introducing this.
Diolch yn fawr iawn, Simon. A wyt ti'n swnio llawer iawn yn well. Mae'r headphones newydd yn gwella pethau, wy'n siŵr. Mae'n bleser dy fi I gyflwyno ar adroddiad cynllun perfformio integredig yn y ffordd arferol. Mi fydd y fformat yn weddol gyfarwydd I aelodau ac i'r bwrdd. Wi jyst eisiau sôn yn gyflym am aseinio pethau oedd yn y cyfarfod diwethaf ynglŷn â 4 agwedd ar berfformiad, a clymu nhw'n ôl yn fy nghyflwyniad yr eitem mae Sam newydd gyflwyno. Byddwch chi'n cofio, a mae yn y cofnodion, y 4 agwedd yw perfformiad sefydliadol, neu organisational performance, perfformiad cyflawni, neu delivery performance, a wedyn perfformiad effeithlonrwydd, efficiency neu productivity, a perfformiad effeithiolrwydd, effectiveness and value. A oedd elfennau o hynny yn yr cyflwyniad I chi newydd gael o ran y Dora metrics a'r sgwrs gyda Claire ynglŷn â gwerth a sut ni'n gallu dangos y rachbynau o beth ni'n gynhyrchu. Felly, ni'n gallu gweld hynna yn yr IOPR, mi fyddwn ni'n ceisio tynnu'r elfennau hynny yn fwy amlwg mewn i'r IOPR dros y misoedd nesaf. Mae gyda ni gylch blynyddol, neu cylch adrodd rheolaidd ar gyfer yr IOPR, a ni'n adrodd yn erbyn yr IMTP ar ein cyflawniad, ar ein perfformiad cyflawniad bob chwarter. Felly, mae hwn yn un o'r adroddiadau mwy ysgafn sydd yn edrych yn gyffredinol neu yn bennaf ar ein perfformiad sefydliadol. Ond mae yna rhywfaint ynddo fe fel cynllun un tudalen, a tudalen 4 o'r ddogfen, ein cynllun ar un tudalen. A wi jyst eisiau tynnu rhai pethau allan fyna, a wedyn byddai'n mynd ymlaen i'r scorecard neu i'r cardyn storio, a wedyn byddai'n cyflwyno rhai o'n cyd-gyfarwyddwyr. O ran beth sydd ar cynllun ar tudalen 4, y cynllun ar un tudalen, wi jyst eisiau tynnu allan rhai pethau, neu amlygu nhw am hynny. Un yw y gwaith mae tîmoedd wedi gwneud yn integreiddio system gweinyddu cleifion Cymru yn Betsi Cadwaladr, so WPAS. Mae wedi bod yn amcan ers blynyddoedd a blynyddoedd I symud Betsi I un instance, dwi'n siŵr beth yw instance yn Gymraeg, un instance o WPAS, ac ai ddim gorddweud faint o waith mae tîmoedd lleol a tîmoedd DHCW wedi gorfod rhoi mewn I wneud I hyn ddigwydd dros y flwyddyn a hanner diwetha. Mae fe'n gyflawniad mawr iawn, a dwi eisiau tynnu hwnna mas yn gyntaf, achos mae'r fath o beth sydd ddim yn cael gymaint o hynny o sylw, oni bai bod rhywbeth yn mynd o'i le. A does na ddim byd wedi mynd o'i le, mae wedi mynd yn llyfn iawn eleni a llynedd hefyd, y cam cyntaf, a wy'n credu bod hwnna'n glod mawr i'r tîmoedd, un tîmoedd ni, a hefyd i tîmoedd Betsy Cadwaladr. Dyna yn union beth ddylen ni fod yn chwilio am yw pethau mawr yn digwydd heb i bobl sylwi, bron. Yn ail, wyth y tynnu sylw ar lansio'r app genedlaethol ym mis Ebrill. Mae'r app yn nawr ar yr App Stores, ar Android a iOS. Mae yna lwybr gyda ni fel bydd aelodau yn gyfarwydd ag ynglyn â beta preifat a wedyn beta cyhoeddus. I ni'n gweithio ar hyn o bryd gyda cynllun i gyflwyno elfennau newydd i'r app a hefyd i ddod â practis yn ystod y flwyddyn eleni, bob practis GP yng Nghymru i gysylltu gyda'r app. Dyn ni ddim yn dod â pawb mlaen yn syth. Mae cynllun cam wrth gam, mae'r rhaglen yn ei arwain ar hynny, a byddai'n croesawu unrhyw gwestiynau pellach ar hynny nes ymlaen. O ran y system gwybodaeth radioleg a'r cynllun diagnostig, byddwch chi fel wnaethon ni gofnodi yn gynharach bore yma. Ni wedi cael sawl cyfarfod ar hynny dros y misoedd diwetha, lot fawr o waith masnachol wedi bod yn digwydd yn y maes hynny, a llawer iawn o gydweithio gyda byrddau eraill a sefydliadau eraill ar draws Cymru. Dwi'n mynd i fy mewn i fanylder yn fyna, heb law am ei sôn bod ni wedi etifeddu cyfrifoldeb am y cynlluniau hyn dechrau mis Ionawr, a bod yna waith dwys iawn wedi bod yn mynd ymlaen wrth i ni dynnu'r rhaglenni hynny ymlaen. Ac eto mae hwnna'n glod i bawb yn ein tîmoedd ni, ond hefyd i tîmoedd eraill ar draws Cymru hefyd. Mae yna cryn dipyn o gydredeg wedi digwydd fyna. A wedyn, dim llawer i fynd fan hyn. Gwaith, mae tri peth yn y cynllun. Allwch chi weld yn y cynllun ar dudalen y lliwiau glas, lliwiau melyn, a mae lliw newydd, sef llwyd. Llwyd yw pethau sy'n cael ei ail raglenni yn ystod y flwyddyn. A dwi jyst eisiau tynnu sylw ar tri o'r hynna. Un yw y gwaith ar y platform data newydd, y National Data Resource. Felly, y cynllun greiddiol oedd i fynd yn fyw yn chwarter 1. I ni nawr yn disgwyl mynd yn fyw wythnos nesaf, dechrau mis Awst. A mae yna lot o waith sicrwydd wedi digwydd yn y maes hynny, achos hwn yw ein ffabric data newydd cenedlaethol ni. Nid yn unig un tîmoedd ni yn DHCW, ond hefyd eto i tîmoedd ar draws yr NHS. Mae yna cryn dipyn o gydweithio fyna, felly mae yna, fel byddwch chi'n disgwyl, lot fawr o waith sicrwydd, diogelwch a cyber a pob peth arall, ond i ni on track i fynd wythnos nesaf ar hyn o bryd. So mae yna lithro wedi bod, ond mae yna amserlen sicr yma. O ran polisi a ddewid data, ni'n parhau weithio gyda Llywodraeth Cymru. Byddwch chi'n gweld yn yr eitem nesaf sut ni wedi newid rhai o'r risgu yn hynny, so allwch chi drafod mewn mwy o fanylder yn yr eitem nesaf, gobeithio. A wedyn yn olaf ar y rhaglen trosglwyddo rhaglen gofal llygaid o Gaerdydd i DHCW. Ni wedi gwneud adolygiad porth, dwi'n meddwl mai dyna yw gateway review. Mae hynna wedi codi nifer o bethau, felly ni'n parhau weithio gyda Llywodraeth Cymru a gyda'r rhaglen a gyda Caerdydd ar Fro mwyn sicrhau bod gyda ni popeth yn ei le yn fyna, felly mae hwnna wedi llithro mewn i chwarter 2. Felly, wy'n mynd i barhau a wedyn croesawu cwestiynau i fi a wedyn na drosglwyddo i Sam nes ymlaen. Wedyn, os ydych chi'n troi at tudalen 5, welwch chi y scorecard. Mae'r scorecard yn edrych fel wedys i ar ein perfformiad sefydliadol ag ar ddoi beth yn benodol, un ar y gweithlu a un ar ein gwasanaethau gweithredol. Felly, na i sôn am y gweithlu, dwi'n Sarah Jane ddim gyda ni heddiw, a wedyn na drosglwyddo i Sam ar y gwasanaethau gweithredol. So, o ran y gweithlu, ni'n adrodd yn wyrdd ar ein absynoldeb salwch, ni'n adrodd yn wyrdd ar ein hyfforddiant statudol a gorfodol, ac ni'n adrodd yn amber ar ein asesiadau datblygu personol. Rydyn ni o dan y targed sy'n cael ei osod i ni gan y Llywodraeth, 85%, rydyn ni ar 81%. Os ych chi'n edrych ar y dudalen nesaf, allwch chi weld yr amrediad dros y blynyddoedd diwethaf, a mae dip bob blwyddyn yn y chwarter cyntaf. A dweud y gwir, mae dip yn isel iawn yn y chwarter cyntaf wnaethon ni adrodd. A y rheswm am hynny yw y cylch blynyddol sydd gyda ni o ran perfformiad, mae'n dilyn y flwyddyn ariannol. Felly, ym mis Ebrill, mae yna lawer iawn o gynlluniau asesu personol i'w diweddaru. a'i adnewyddu. Mae eisiau ni wella achos ni o dan y target. Dyn ni ddim mor bell o dan y target ag oeddwn ni llynedd, felly ni'n wella o flwyddyn i flwyddyn, ond yn amlwg, dyn ni ddim yn llithro o dan y target o gwbl. Felly mae bob cyfarwyddwr wedi cytuno rhaglen gyda'i staff mwyn cael ni nôl â'n ei le. Ni eisiau bod sef yn gysurus uwch ben y target o 85%. Trothwy yw hynny, nid rhywbeth i ni gyrraedd. A wedyn, yn olaf, a na i drosglwyddo i Sam fan hyn, o ran ein gwasanaethau gweithredol, ni'n adrodd ar y scorecard fan hyn ar lefel cyrheiddiad neu IT Service Availability, mae hwnna lan yn uchel iawn yn agos i 100%, a wedyn ni'n adrodd ar ein cefnogaeth ar prif ddigwyddiadau IT. Felly, beth wy'n credu na'i wneud yw, na i stopio fan hyn a gwahodd i Sam just i sôn am y pethau hynny sydd ar y scorecard, a wedyn cadeirydd dros rwydd yn ôl i chi er mwyn cymryd cwestiynau yn gyffredinol ar draws yr adroddiad, os yw hwnna'n iawn. Diolch.
Thank you, Ivan. Just to call out a couple of points on the operational performance. So on slide 12, we can see the graph that shows the availability plotted over the course of the last 3 financial years, and we can see that that's been consistently above the 99.9% target that we've set. But more importantly, it's increasing year on year, and availability so far for this financial year is 99.989, which is very high and is well above our target, as I say. The other thing I wanted to just point out is the incident, the volume of major incidents. So we had a bit of a spike in April, which was in the previous reporting period, and I'm pleased to see the levels going back down to somewhere nearer what we would expect. So we've had 11 major incidents during this reporting period, which is still higher than we'd like, and we are looking at them. And 7 of those relate to Bwrdd, so we're of course looking at that in particular detail. That's not a service which we host ourselves. It's hosted in a sort of distributed way across the other health boards, but we are working with them to understand whether there are any common themes there and what can be done. And we do review incidents through our incident response and learning group, where essentially where SLAs are breached or where the impact or severity is at a particular level. So we'll be picking that up through that process. Thank you.
Thank you, Sam. Thank you, Ivan. Any questions or comments on either Ivan's? Okay, David, and then Claire, and then okay, Claire's just disappeared. Oh, everything's jumping around now. Okay, David, and then Claire.
Okay, it's just some comments. Thank you, Simon. I just wanted to say really well done on the WPAS rollout in Betsy. That's a significant achievement. Good to highlight that, even. You touched on the work the commercial team are doing. I think you underplayed it a little bit. They've done a spectacular job over the last 3 months of turning around a difficult situation. So I just wanted to put on record my thanks to the commercial team for a job really well done. And finally, on the app, as a beta user of the app, I've now managed to order a repeat prescription and even book a GP appointment. So I'm really pleased with where it's got to, and I'm looking forward to more functionality coming online in the near future. Thank you.
Thanks, David. We'll take a few, and then well, I'll probably take everyone, Ivan, if you're happy, and then ask you or others if you want to come back in afterwards. Claire.
So as Ivan's already alluded to, a lot of activity this month in and around programmes, but also operationally as well. Maybe worth, I was going to ask even if you update, you know, the NDR progress is ahead of, is doing well, but we've now had formal confirmation for the annual funding in the quarter. So that's helped us now relook at that, the requirements for that programme this year. And equally, I would echo David's response around the app. We've seen some great progress, and actually you'll see in the finances later that actually the programme spend is higher in Q1, really reflecting the activity that we're seeing in that. So I really would want to, if you're going to comment on that. And the other one for me is operationally, and you'll see it in the capital report later on, we've made some great progress in preparing for our data centre move later in the year. So again, during the Q1, I know Sam and the team have been working really hard to deliver all the work that's necessary, and all the preparation work is underway in relation to the data centre move. So those are areas, 2 areas worth pointing out. And the final one for me is in relation to there is a lot of work underway in relation to recruitment. So you'll see, although there is a lag in our recruitment numbers, actually there is quite a lot of activity together with the strategic resourcing group working on that trajectory for now and later in the year. Thank you, Chair.
Thanks, Claire. Rowan.
Thank you, Simon. Couple of questions, Ivan. One is really thinking back to the change in governance arrangements for some of the programmes that are being reprofiled and perhaps moving to the right. Do we have any comments on how perhaps if the new governance arrangements might reduce seeing those types of reporting on our performance report? And then secondly, my second question is, related to the Minister's enthusiasm for AI. Some fairly major activities there where we've still got limited confidence in budget being available, and perhaps recognizing that you will need to see investment in those lines before we can really maximize the applications of AI safely in healthcare. So I guess, one is changing governance, and two, are we expecting that uncertainty in funding for those lines in the IMTP to continue?
Thank you, Rowan. We'll come back. Obviously, they'll pick up on those questions, Ivan. Marion, finally.
Diolch, Cadeirydd, a gai unna ategu fy llongyfarchiadau ar WPAS yn cyrraedd y gogledd ar ei hyd. Mae wedi bod yn daith hir a heriol, a mae'n hyfryd gweld hwnna yn ei le yn llwyddiannus erbyn hyn. Ond mae'n cwestiwn i'n ymwneud ar app Ifan os cai, ac mae'n braf clywed gan David bod ddefnydd llwyddiannus o'r app. 5,000 o ddefnyddwyr, mae'n ymddangos wedi llawrlwytho yr app yn ystod y cyfnod arbrofol yma. Ydy'r ffigwr yma, Ifan, yn cyfarfod yn disgwyliadau ni yn ystod y bita cyhoeddus yma, a beth ni wedi ddysgu o'r arbrawf yma hyd yma, beth yw'r gwersi i'r dyfodol i ni fel sefydliad? Diolch.
Diolch. Ifan. Felly, na i ateb y cwestiynau in reverse order, fel bod fi'n gallu ateb Marian yn gyntaf yn y Gymraeg, a wedyn, falle symud y Saesneg Gymraeg, can i weld. Ydy'r cynnydd yn y defnyddwyr a'r surgeries sydd wedi cysylltu ar app yn cyrraedd ein disgwyliadau neu'n cynllun, ydyn hyd yma, achos oedd e'n fwriad, a mae wedi bod yn fwriad o'r dechrau, i fynd yn araf yn y misoedd cyntaf ac wedyn i gyflymu. A'r amser rydyn ni'n bwriadu cyflymu yw o fis Awst ymlaen mewn i'r Gwanwyn, mewn i'r Hydref, sori, ar gyfer y practisau sydd ar IMIS, a wedyn dal lan ar y practisau sydd ar Sejadim trwy'r gaeaf mwyn cyrraedd pawb erbyn diwedd y flwyddyn ariannol. Mae tua 10% o'r practisau sydd yn Cymru ar hyn o bryd wedi cysylltu. Ond mae hwnna hefyd yn swnio'n ffigwr isel, achos tua 35 yw hynny. A ni'n anelu erbyn yr Hydref, a wy'n mynd i fod yn gwasanaeth sifil hwnnw, mae'r Hydref yn beth sydd yn ymestyn o'r ffordd lan yn Nadolig. Ond yn yr Hydref yn anelu gyda tua hanner y practisau, so tua 200 arall, a wedyn gobeithio gorffen y blwyddyn newydd. Felly, i ni ar ein cynllun. Beth i ni wedi dysgu yw bod yr app yn, beth byddwn ni'n gweud, yn resilient ac yn solid, a bod ni ddim yn gweld gwallau gwendidau, ac i raddau bod y broses o gysylltu i'r GP a'r practice GP, bod ni yn medru gwneud hynny yn weddol unionsyth ac yn weddol syml iddyn nhw, a dyna pam i ni medru cyflymu, a dyna'r pethau o'n i eisiau gwirio. Felly mae ar gynllun. O ran, i fi droi at y cwestiynau eraill sydd gyda fi. O ran, Rowan, so, ydy'r newid mewn llywodraethiant rhaglenni yn mynd i leihau slippage? Fi'n credu bod hynna'n anodd iawn dweud. Nid y rheswm am adolygu llywodraethiant oedd yr aneglurdeb ynglyn â pwy oedd yn atebol, nid oherwydd bod ni'n teimlo bod llywodraethiant yn aneffeithiol ar draws yn rhaglenni. Fel ych chi'n gwybod, mae gen i lawer iawn o raglenni. Mae beth i ni'n gyfrifol am ddilifro yn gymleth, a mae pethau yn cystadlu am adnoddau drwy'r amser. A mae yna llawer iawn o ddibynnedd rhwng un rhaglen a'r llall. Dwi'n credu bod hynna'n mynd i barhau. Mae adnoddau yn gyffredinol yn mynd yn fwy tyn, nid yn llai tyn. A mae rhaid i ni wneud popeth fedrwn ni mwyn symuleiddio pethau. Felly, dwi ddim eisiau gweud bod newid llywodraethiant yn mynd i leihau pethau. Wy'n credu wy'n gobeithio bydd e'n neud yn haws i'r bwrdd gael sicrwydd yn gynt o beth sydd yn digwydd, a gobeithio hefyd yn galluogi ni ymateb yn gynt hefyd, achos bod gyda ni lywodraethiant sydd yn fwy streamlined, swn i'n dweud. A wedyn rhan y gweinidog ac arian yn cael ei cysylltiad gyda AI. Na i adael i Claire yn y adroddiad nesaf sôn am ddeini o ran y sicrwydd i ni'n cael oddi wrth y llywodraeth yn ariannol. Credu bod ni'n gyd yn deall mor heriol yw'r sefyllfa ariannol ar hyn o bryd. Ond i ni wedi i fi roi enghraifft o'r National Data Resource ar AI. Dros y mis a hanner diwetha, ni wedi ail-edrych ar sut i ni'n cyfathrebu ar y National Data Resource. A ni'n ceisio bod yn fwy clir bod angen y data fabric newydd yna arno ni mwyn i ni fedru manteisio ar y dechnoleg AI sydd yna. Mae'n anodd iawn i chi ddefnyddio technoleg AI na pam i chi ar hen isadeiledd, ar hen systemau on-premise gyda data wedi wasgar dros y lle i gyd. A wy'n wedi cael ymateb positif a cadarnhaol iawn i hynny, oddi wrth cyfarwyddwyr digidol, oddi wrth y llywodraeth, a oddi wrthoch chi yn y bwrdd, wrth bod ni'n trafod hynny gyda chi. Felly, fi'n credu bod ni yn newid yn dehongliad rhywfaint. I cwestiwn, David, diolch yn fawr am y sylwadau. Do'n i ddim eisiau sôn am y tîm masnachol yn ormodol, achos yn hym i oedd fe'n swnio fel fi'n congyfrach yn hym fy hun. O'n i wedi rhoi fe'n nodiadau fel mae'n digwydd, ond wedyn nes i benderfynu i ddim dweud, so diolch yn fawr iawn am sôn am hynny. A wedyn, o ran y cwestiwn oddi wrth Claire ynglyn â'r chwarter cyntaf, nath y sain, nes i colli sain tybyn bach hwnna, ond dwi'n meddwl oedd e'n cwestiwn ynglyn â lle ni ar yr endiawr, oedden ni'n gallu cyflymu nawr bod ni'n wedi cael y cyffur oddi wrth y llywodraeth wedi gadarnhau, a i ni'n cyfeirio hwnna yn yr eitem nesaf, a i ni'n gweithio ymlaen o ran yr app. So mae gyda ni sicrwydd ariannol ar gyfer eleni sy'n galluogi ni i gyflymu, ond mae gyda ni, wy'n credu bod yn deg i ddweud, wy'n gwybod bod hwn yn gyfarfod cyhoeddus, ond bod blwyddyn 2 a blwyddyn 3, mae llai o sicrwydd o ran y runway ariannol gyda ni fyna, ac yn amlwg wedyn mae hynna'n gwneud i tipyn bach yn fwy heriol o ran cynllunio ymlaen mewn i blwyddyn 2 a blwyddyn 3, ond jyst i sicrhau'r bwrdd, i ni'n mynd mor gyflym a fedrwn ni eleni. Mi fydde fe falle'n haws i gynllunio hynny trwy'r IMTP a trwy'r rhaglenni gyda sicrwydd ymhellach allan i'r dyfodol, a mae hynna wastad yn mynd i fod yn wir.
Diolch, Ifan. Thank you. Any other questions or comments? No, thank you, Ifan, and thank you, Sam, for your contribution this item. And we've been asked to receive this report, which I'm sure we're happy to do. If I move then on to item 6.2, the Corporate Risk Register report, and invite Chris to introduce this item. Chris.
Thank you, Chair. Yeah, so I'm just going to run through our current risk profile position. So for today's board meeting, we currently have 28 risks on our corporate risk register. 16 of them are detailed in the papers. There are 12 which are considered private. So these are considered in the private sessions of the relevant committee meetings. Under section 3.6 of the report, I'm just going to run through changes on the corporate risk register over the last few months since our last meeting. So we'll cover off new risks that have been removed, and risks where there's been a change in risk score. So just starting with new risks. Firstly, the citizen and stakeholder trust in the use of health and social care data. This is 0320. This is a reframing of a previous risk around the data promise, and members of the Digital Governance and Safety Committee will be aware that following conversations with Welsh Government, that risk has intentionally been updated, reframed as a new risk to reflect the current position. Ridian has approved a risk around sustainable funding for WASPI, the Welsh Accord for Sharing of Personal Information. We're hoping there is a mitigation there, but given the current financial context, I think it's probably very important that we do flag that as a risk. And likewise for the next new risk, 0322, NDR Phase 3 funding. Should note this risk came on before we had confirmation of the 12 months funding we've now received from Welsh Government for this financial year. But as Ivan just alluded to, there is probably some uncertainty in future years. So I think, well, I know Ivan's looking at that and reassessing that risk to reflect probably longer term potential uncertainty. And then two risks that I will invite Ivan to comment on: 0323, the cost for transition to and ongoing operational support for the development of the NHS Wales app and platform of services. This was a previous risk, it dropped off, it's come back onto the risk register at a lower score. And the second one I'll ask Ivan to comment on, 0324, availability of resources to support the Welsh Intensive Care Information System programme. Ivan, do you want to comment on those?
Thank you very much, Chris. So I'll cover both of those quickly. So the NHS Wales app is delivered for us, developed and delivered and currently service supported by a third-party contractor, but it is our product and we will need to transition, and we intend to transition it into our own organisation, but it is programme funded. And unlike the traditional full business case model, there is not a sort of a recurrent sign up from health boards or from the system collectively or elsewhere. But it is really important that we transition it into our own organisation. So we're working very closely with Sam's team on how we do that and when we do that and what that means. And I think the thing which is implicit in the risk is that we don't want to take a minimal, as in stop doing any development work and transition it across as is and just hold it. We need to be able to continue to do development as well as the maintenance support and the service and various other things. And our ability to do that depends on the funding model. So so there is a risk there that if the funding model is not sufficient, we're going to have to redeploy resources from other areas, and or we're going to have to curtail the development, which is something which is really important for something like the app, which is a consumer-facing product with an open architecture.
Can I just add something there, Ivan, because I think, as I mentioned in my chair's report with my appraisal with the minister, where we discussed sustainable funding, the continued funding of the app beyond its development stages is currently identified as one of the key issues I highlighted, because clearly it's a flagship project that we want to develop and continue to develop, and so it's out there. There is an understanding that it's a serious issue that we need to address in the context of our wider sustainable funding approach.
So
thanks. Sorry, Ivan.
No, that's fine, Simon. So I mean, of course, you're the chair. But this is what the risk register is for. We identify uncertainties and then we try to manage that through conversations with Welsh Government and within our own organisation and other things. WCIS, as happens so often in specification-based procurements, there has been an additional cost demand on the WCIS programme, partly due to configuration requirements, partly due to inflation provisions that that were not forecast in that way when we originally procured several years ago, because we're in a very different, inflationary environment at the minute. That's caused some pressure on the programme. Because of the way this programme is structured, Welsh Government is the primary funder in the programme delivery phase, so we're having discussions with them, and there's a degree of uncertainty. It's manageable, so we're, as mitigation, we're looking at what our timetables and our profiles and various other things are, but we're identifying it in the corporate risk register because we want to maintain our timetables and we want to deliver to the original targets and we want to deliver the specification that clinicians require. But there is no magic money tree, as I'm sure Claire will say in the next item. So there's a risk there that we need to manage. And no doubt we will see more of these risks coming through because there's more tension comparatively to where we were as a system and as an organisation a few years ago.
Thank you, Ivan. I'll just move on, if there's no questions on those two items particularly, just to highlight the risks that have been removed. So the data promise, as mentioned, that's been reframed. So although it's come off, it is still on there and it's still being overseen by the Digital Governance and Safety Committee. The last meeting we had NHS Wales SLA income increases. So we had two meetings, the one in March where it was our highest risk, and we still had it on in May as a reduced risk, because I think we were waiting for one organisation to confirm. That has happened now, so that risk has been removed. There's two risks around the switching service, succession and responsive development, that have been removed from the corporate risk register. They remain on the operations risk register. And there's one around digital cost pressure, the exchange rate fluctuation, that has dropped off the corporate risk register. Just to highlight three areas where there've been changes in risk scores. Staff vacancies, this has increased slightly from a score of 12 to 16. And as Claire mentioned in the previous item, there's a lot of activity going on here. There has been a slight lag, which is probably what's driving that increase in risk score. But there's a lot of activity going on to hopefully mitigate that risk. And I'm hoping that will come down over the course of the coming next few months. And then the switching service data warehouse 0269. This risk has changed ownership to EVAN. I think recognising that the solution to mitigating this risk is very much on the NDR. So EVAN has reviewed and reframed the wording for the risk and the scoring associated with it. And finally, 0313, the digital cost pressure service model changes. This risk has dropped as well under Claire's agreement, and it's decreased slightly in risk score. So I'm just asking the board particularly to note the changes in position from a risk perspective. And I think Evan made a really good point. There is a lot of tension in the system at the moment because of the context, the financial context within which we're working. Claire will cover that in the next item, so I won't go there. But just to say, I think our risk profile over the next few months might change. And board members will obviously be aware of our risk appetite and our approach to risk, which we'll need to consider as we consider the financial position.
Thank you, Chris. Thank you, Ivan. Anyone, any questions or comments? David.
Thanks, Simon. Thanks, Chris, for the update. Just wanted to comment on a couple of things. So firstly, great to see the switching service being resolved. It was one of the things that we did a deep dive on early on in our tenure as independent members. So great to see that we've closed that one out or moved it to a lower level. In terms of the staff vacancies risk, I note in Claire's report that's coming up that we've already hit 84% of our target saving associated with staff vacancies, which worried me a little bit. I hear what we say about a initiative to catch up and try and fill that. What I'm more concerned about is what's the impact of that on any of our in-flight programs. So it's okay to make some saving. We're trying to sort of cover that, but is there any impact on programs of work that we should be made aware of? Is my question.
Yeah, well, David, I think there potentially is impacts, and I think it's a really good question to ask, because I think we are at a point now where the financial position and potential choices we have to make around vacancy fill rates may impact programs. In terms of specific programs, I don't know if Ivan or Claire want to highlight any in particular where there are concern areas.
Go on, Claire.
I would say that actually, David, if you look at the profile of the recruitment, you'll still see that September will be really the key touch point in terms of some of the programs in relation to recruitment. So if you look at our key programs, NDR in particular, actually, and somewhat they delayed the recruitment and would have done because we were just awaiting the funding confirmation from Welsh Government, which we've only just received. WCCIS again has got a 25 coming up in September, October. So I think where we really will have a true impact of the operational risk associated with delivery will be at the half year, when actually the true implications of that will be felt. And given where we are now, and I'll touch on it in my financial presentation, what we are looking at is what choices we've got in terms of whether we recruit or not, to try and balance the operational deliveries and programme commitments together with the overall financial position. So we may decide proactively to slow things down and actually not recruit, in order to actually come in lower in our overall financial position and contribute more to the NHS. So at this point, as you saw with the deliverables, there's 1 or 2 that shifted out, but actually there's nothing significant. I think probably at the half year is when we'll really understand and would have evaluated whether we actually are going to recruit to those positions or not. But to date, we haven't had any further operational risk to our programmes or to our operational delivery. Even, I don't know whether you want to add anything.
Yeah, you're absolutely right, Claire. You know, the workforce profile for the NDR is to very significantly ramp up now that it's up. You know, once it's operationally live, you then ramp it up in order to exploit, you know, extract the benefits and to drive those. And that is a key decision that we're going to need to take. I think the thing I want to emphasise is that we'll be taking that decision collectively with the Welsh Government and with other health boards. You know, as you heard from my update, we are working really, really closely with health boards on several major and very complex things. RISP and WPAS are examples, but so is the NDR. We've got a meeting next week with all the directors of digital, where we're looking effectively at the traffic across all of our programs over the next 2 to 3 years, the resourcing requirements, because they are under probably, you know, as much, if not more pressure as we are. So there are tough choices ahead, but you know, all I can say is that we're not taking these unilaterally. We're working very, very closely with our key funder partners, key stakeholder partners, delivery organizations, to try to get an optimal way through, given the circumstances.
Thank you, Ivan. Andrew.
I mean, this is something that we discuss in local partnership forum, and operationally we'll obviously have discussions around various things. I mean, my only concern ever when it comes to not recruiting is the effects it might have on existing staff with programs of work that might be unavoidable. You know, I mean, it's sometimes easier to possibly delay parts of projects to try and accommodate for resourcing issues, but when you've got live services, you know, that possibly we may not recruit to as quickly. I mean, that's basically my only concern. But obviously, I'll work. A lot of my work's outside of this board in private, so I'll continue to discuss that in forums like local partnership forum.
Oh, I share that concern, Andrew. You know, when you're managing your finances around staffing, it's not always the gaps aren't always where they would ideally be, are they? I mean, it's one of the big problems. Helen, you want to come in, and then we better move on.
Yeah, it's just responding to that that you know, that kind of challenge, I suppose, from Andrew. And you're right to be that kind of voice of the staff on the board here, and it's got to be central to any decisions or options that we've got for decisions around kind of the targets that we would set ourselves in terms of the financial recovery of the wider NHS. So it's a fair challenge, but it'll be central to those options and choices that we develop, and we will work that through with you as staff side as well, and through the partnership forum, to make sure that staff are on board with that.
Thank you, Helen. Chris, is there anything you wanted to come back on before we? No, lovely. Okay, so we are being asked to receive Chris's risk register report. I'm sure we're happy to do that. Thank you very much. We move on then to the finance report, and I'll hand straight over to Claire.
Thank you, Chair. Diolch yn fawr. I will start. I think there's some slides coming. So if we go straight to slide 4, I'm conscious that slightly over time, but we should be able to do that. Right, what I'm going to cover is the Q1 position. But before I start that, it's worth just touching, and we'll touch on this this afternoon, on the position of financial accounts for the previous year, 2022-23. And I just want to thank the team, but also thank the Audit Committee, Internal Audit, Welsh Audit and Counter Fraud for the support and also relevant challenge throughout the year that has enabled us to have an unqualified audit opinion, and that we've met all our strategic statutory requirements in both capital and revenue. Just for you to be aware, the audit committee met on the 18th and agreed and approved the accounts. Hopefully today, this afternoon, we will also review and approve those accounts. That will enable the Welsh Auditor General to sign those off later in July, and that will line us up for the September annual general meeting. So we hopefully, with a bit of luck, can say goodbye to last year and then move on to this financial year. So if we move on to the next slide. So I'm going to summarise where we ended the quarter, and this table shows us where we are in relation to our statutory requirements, with the cumulative performance at the end of Q1 in relation to the previous board, but also our financial outlook looks green. And this really shows that both from our revenue perspective, we were slightly underspent at the end of the quarter by 81k, but we're still forecasting a break-even position. Capital, similarly, there's a lot of capital spend, and it will echo some of the points that Evan raised in the performance report. We made some great progress, both with the programmes, but equally, as alluded to, the data centre move is moving well, and we'll see that in the capital spend, but slightly below planned overall by 30k. The public sector pay policy is in line with where it should be, and the cash balances currently at the end of the quarter were 5.7 million. Actually, we were going to grow those, because what we'll start to see, and we'll see in August, is the payment of the Microsoft contract. So there'll be a significant cash inflow and outflow as a result of that. So if we move on to the next slide, which will show us really what our revenue run rate is looking like. So in the first quarter, we spent £38.3 million. 15 of that was on pay, and 23 million of that was in non-pay. And you can see our predicted run rates are looking to increase slightly within the pay and with our forecast recruitment, and will fluctuate in non-pay, predominantly reflecting payments in and around the digital programmes. So our run rate is looking reasonably healthy if we move on to the next slide, which then shows to us what's happening within DHEW. This is our bridge, which shows you, for those in blue, are the directorates within DHEW that are slightly under budget, and for those in red are those directorates that are slightly above plan in relation to their spend. And actually, it echoes some of the conversations we've had already. So for the ones in blue, the driving factor there is the vacancy factor that we've been talking about. You will notice, David, actually, that many of those directorates are non-operational, so in terms of programmes delivery. So those are our support organisations, and it really echoes about Andrew Fletcher's pointers about, that workload falls on others, so we have to balance the requirements and work well together to balance the demands on those support functions against delivery. In operations, what we're seeing there is, as predicted, we are seeing some challenges around energy costs and contractual costs within Sam's department. And obviously they're working on mitigation actions to offset those. And obviously we've taken a proactive response in recruitment, so hence why workforce is slightly overspent, as we've brought in additional resources to help with some of our recruitment campaigns, and clinical slightly overspent, but Rydian assures me he'll be back on track by the end of the year. So that nets itself off to a slight underspent at the end of the quarter of 81. I'll move us on to the next slide, which then shows us a summary of all our digital priority investment funds. So that's 38 million for the year that's allocated to DHEW now for spend within digital improvements. What that shows that in the period to date, we actually spent 8 million, which was slightly ahead of the plan of 7. And the areas that we've seen ahead of plan as really focused on was really around the app and the development of digital services for patients and public. But equally in WCCIS, we're seeing a slight spend trajectory ahead of plan. However, all of the programmes are predicting a year-end position of balance. But having said that, what we are doing at the end of the quarter, now we have clarity on the funding allocations, is we're doing a review of the forecast, which we'll then bring back to the board later to give assurance really of our trajectory, spend and position as we move forward later into the year. So I'll move on to the next slide. This really then shows us another important aspect of spend and one where money is particularly tight around the NHS this year, which is the capital spend performance. We've got a budget of 13 million for this year. 2.6 of that is our own discretionary spend. And then 10.4 million of that is our digital. You can see for both, we're slightly ahead of, we're on plan in terms of our spend. And in particular, if you look at our discretionary, it's slightly higher. We've spent nearly just shy of half our spend within the first quarter. And that really reflects the work that's ongoing with the data centre move. So a lot of the infrastructural requirements and procurement is underway, and work is really making pace now in that move, which will happen in Q4 of this financial year. So there's nothing else to note on that one. I'll move on to the next slide, which really looks at our savings plan. So I'm delighted David has done his homework on this one and is ahead of the game. But we have, as you know, we initially presented an unbalanced plan as a consequence of a 1.8 million cost pressure this year, reflecting 800,000 on energy and 1 million on contractual ones. That was added to our savings target, and as you can see to date of that savings target, our plan was to achieve 1.2 million. We've actually achieved £200,000 more at 1.4. But what it does show, as David's pointed out, is that we are ahead of the game in terms of our pay efficiencies, reflecting the vacancies, as you saw in an earlier slide, across the directorates. And in some ways that creates financial opportunities, but other ways there are risks associated with that. So I'll move on to the next slide that shows actually where are we in terms of our level of confidence in savings, those savings plans. The ones in green are the ones where we have a clear plan and ability to deliver that. The ones in yellow is still to be finally confirmed, and the ones in red are ones where we need to start that work underway. But as you've already seen in the previous slide, we're ahead of the game in terms of that. So worst case, we could net that off. And I'll come back to savings and our savings plan a bit later to look at the more forward view. So that's where we are in terms of our savings plans and performance, and those budgets and those requirements now have been implemented within the budgets across the directorate. So we've built in those savings into the budgets across this month. So if we move to the next slide. So in terms of risks and opportunities, at the end of the quarter, we are seeing inflationary pressures hit and affect some key areas as predicted. We do have some savings plans that are low risk given where we are with the savings plans, but there are some opportunities there. We are still working on opportunities within the Microsoft VAT recovery. In fact, HMRC were at the offices last week. And we're also working on the vacancy, you know, as some would see it as an opportunity, some others see it as but also a risk around what decisions and choices we need to make in order to deliver that. So that was the position as at the end of the quarter. Subsequent to writing the report, obviously the overall NHS Q1 position has come to the fore, and that has actually shown that as a system, we need to really consider and review essential spend for the forthcoming year and action any achievable changes to our plans that would enable us to actually deliver more savings for this financial year. So together with the executive team at DHEW and to enable us to respond to Welsh Government on that request by the middle of August, the team are working on what we could do over and above to deliver system savings to the NHS in Wales. So I'm sure at a subsequent board we will detail some of the choices and actionable changes we might need to make. And that's why I said probably September is a good checking in point, because in order to do that, we have to work with and collaborate with our programmes. and consider collectively what we could do and look at the impacts that may have. And obviously that might take a bit of time. But I can assure you as DHCW, we will play our part and we will look at anything that we can do to support our colleagues across the NHS in what is a very challenging financial position. I think that was the last slide. So I'm looking to the board to note the financial position, and I'm happy, Chair, to take any further questions anyone may have.
Thank you, Claire. And the slides are down now. Anyone, any questions or comments? David.
Thanks, Chair. Thanks, Claire, for the report. Just wanted to say a couple of things. So, firstly, well done on closing out the year and closing out the year with a good set of results. So well done on that. And also on the saving plan, really good to see so much green on the shape, I would say, with regard to the savings plan that you put forward. My question was not something you mentioned, but something was in the covering paper, which was to do with the iCare programme, which is looking to transfer into DHCW. There's a bit of a exercise going on at the moment to sort of establish the financial position of that programme. I just wondered whether you can say anything about whether there's going to be sufficient funds for us to kick-start it, or whether in light of the other pressures that are in the system, this might be something that potentially gets paused as a result of funding availability.
Thank you, David, and a really good point. So as of yet, we haven't done all the financial due diligence around the transfer for iCare, and we're meeting with Cardiff and Vale next week, actually, which would then give us I'll be able to answer your question more accurately. I do think it's there are no boundaries to the choices we have to make. So just like any other programme, we will have to look at it with that context, and we will do, no doubt.
Thank you, Claire. Rowan.
Yeah, I mean, in a difficult position doesn't really cover the challenges I think we're all facing. It's obviously not a surprise coming out of a pandemic that the NHS in Wales is in the position it's in, because there's increased morbidity just because of a pandemic. There was a difficulty during the pandemic of monitoring people with chronic conditions. Those may have deteriorated, so the care they need is more expensive. There's a multiplicity of demand drivers on a system which is is funded within an envelope of affordability that just doesn't meet that demand. So very, very difficult position. I suppose that there's two areas that are going to be, I think, really challenging for us. One is we have some major programs that we're seeking to deploy during this period, and just ensuring that our partners in the health boards have the resources to deploy them in the time frame for everyone to get what they need and be successful in that time frame, I think is going to require system-wide planning and thinking and additional communication, so to be able to deliver successfully in this current environment. So some thoughts about how we might work across borders, if you like, to make that happen. I think the second piece is related to your sincere comment about be assured that DHCW will do its bit, and seek to use our funding really wisely. I would just suggest that part of that may actually be trying to make the case to invest in particularly the data-driven services that allow us to avoid unnecessary or unplanned care by trying to get the prevention agenda in. And I think recognizing that even in these situations there will be a need to invest, because we will not get out of this position by continuing to do the same thing because of those demand drivers. So just trying to keep that balance really, which is going to be incredibly hard given the conversations we're having.
So I think that
before you come in, Claire, Helen.
Yeah, thank you. It's actually in response to Rowan's well-made point, really, in terms of the role that we can play right across the spectrum of our the services that we provide. We had NHS Wales Leadership Board this week. That's the board where all of the chief execs and all of the directors in Welsh Government sit. And we had 3 presentations that were talking about using the data that we have across the health and care system, that we're looking at from Public Health Wales, the prevalence of disease and the burden of disease, the cardiovascular update from the cardiac network around the issues and challenges around cardiovascular disease and the trends that we're seeing there at the moment. And then the really good work that the team here have been involved in with the last years of life dashboard development as well. And it gets you into that conversation about the common risk factors and the prevention agenda, and the data gives you the insights. And I think all 3 of those are very different approaches, but actually we're providing very actionable, real insights for operational teams to look at how services can change. And there were real examples of where that's happened based on the data that was being generated. And you're right, Rowan, it's more of that we need to ensure that we're providing out to the service and supporting that. So it was just to say that that's very much the focus in terms of some of the thinking that's going on around the current context and recovery.
Yeah, Helen. Claire.
Yeah, so I think the pandemic did have an impact, but it wasn't alone. Inflationary pressures and other aspects, growth in the underlying demand. When you add it all together, it does create then quite a gap in terms of what we have to recover. So I would echo what Helen says. I think from a DHCW perspective, the focus is on economy and efficiency. What can we do to reduce the price pressure, and equally what can we do and do it more efficiently and effective than what we currently do. But we shouldn't always look in, we also have to look out. And as you rightly said, there may be an argument actually that DHCW has to spend more to enable our colleagues in the system to save even more value further down the chain. So the answer is going to lie somewhere in the middle. And really what we're working collectively is to find out where that sweet spot between us is, and how do we align our priorities and the choices that we make to ensure that we make the right decisions around what actions we're going to take over the next 6 months. So we've got quite a lot of work to do, and we will respond to we're aiming to respond to Welsh Government towards the middle of August with what options we've got.
Thank you, Claire. There's no further comments. Thank you for the report, and obviously going to come back to you after the break, Claire, to pick up on the annual report and accounts that you mentioned at the beginning of your presentation. So we're asked to receive that report, which I'm sure everyone is happy to do, and then move on to the last item before we break. And that's no pressure, Sam, I promise you. It's the Senior Information Risk Owner Annual Report, and I invite Sam Lloyds to kick off this item.
Thank you, Chair. So I'll keep it brief in the interest of time. But as you say, this is the CIRO report for the financial year to March 23. Provides an overview of the information risk management approach that we follow in the DHCW, highlights the key improvement activities underway, and summarises audit and assurance activity that's validating our posture. So in terms of our information risk management framework, we have a number of key roles in place to oversee it. So Helen, as Chief Exec, is the accountable officer for information risk management. Myself as the CIRO, Ridian, our Exec Medical Director, is the Caldecott Guardian. We have the Data Protection Officer in place, and we are all in those roles supported by our information governance and cybersecurity teams. Assurance and oversight of information risk management is provided by 2 committees, which are chaired by our independent members, so Digital Governance and Safety Committee and the Audit and Assurance Committee. And then building on that, or supporting those committees and roles, we've got a number of controls in place in the form of processes, policies and tools. We've also set out our risk appetite across a range of information risk management domains, and it's important to note that the risk appetite differs by domain, so we're not taking a blanket approach. So, for example, we are slightly more tolerant of risk in the domain of information sharing than we are in information storage, although obviously we take great pains to protect both. There's a number of specific improvement activities that have been completed in the course of the last financial year. So we implemented a new IT asset tracking system. We've developed the cyber plan and business case, which is currently with Welsh Government awaiting approval. We've retired a significant amount of legacy infrastructure across our IT estate. We've accredited our email system to the NHS Digital Secure Email Standard. We've achieved accreditation under the Digital Economy Act in our role as trusted third party to the SAIL Population Data Bank. We've tested our cybersecurity response plan, and we're continuing to develop the information governance framework and strategy. We've also been subject to a number of audits, including our successful recertification to ISO 27001, and we've had audits by both Audit Wales and the Shared Services Partnership internal audit function. The report ends with statistics on FOIs and subject freedom of information requests and subject access requests, and also volume of data incidents, which I won't go through, but they're available in the report, and also with a summary of our information risks. Thank you.
Thank you, Sam. Any questions or comments on Sam's report? No. Okay. So we've been asked to approve the report. So it's an active approval of that report. And people happy to do that? Yes, we are. Thank you very much. Okay, it's 20 to 1 now. I suggest that we stick with a half-hour break and we return at 1:10 and if everyone could remember to turn their cameras off and mute, and then I'll see you all a few moments before 1:10. Thank you. Welcome back, everyone, to the afternoon session of today's board meeting. The first 3 items are covering of the issues around the annual report and annual accounts. And first, if I could invite Marion to give feedback from the Audit and Assurance Committee. They reviewed the accounts and report at the last meeting. So over to you, Marion. Has she not joined?
I think she might not have rejoined yet, Simon.
I'll have to start that again.
We'll have to pause, I think, for a minute or two, give her a minute to come back.
Sorry, I'm having a little trouble with my screen today, so pictures are going in and out, so give her a moment. Anyone message her? Just to see if she's having trouble. Because if she is, then we'll move on to Claire and we can come back to that item after. I tell you what.
I'm happy to do the update in the absence of Marion, Simon, as I was at the Audit and Assurance Committee.
Yeah, please do, Ruth, because it makes more sense to have it in this order. So if you like to give a verbal update on your review of the report and accounts. Over to you, Ruth.
Thank you, Dale. I mean, I think it was a very, very positive meeting. You know, very, very pleasing again as a committee to have the final audit of the accounts presented in front of us. You know, as ever, we looked at the internal audit plan. And had a conversation around the opportunities that we've seen over the last year, opportunities for learning going forwards. Marianne has joined us, so I will hand over to her and not continue with that update, as I don't want to steal her thunder from what was a very positive meeting, I thought.
Sorry,
thank you. We've been having slight Wi-Fi problems here. Thank you for bearing with me.
We're having an interesting time, many of us today. So yeah, we kicked off giving some feedback from your last committee where you reviewed the report and the accounts. So, I mean, please do pick up and add any comments you wish to, Marion.
Wel, diolch Cadeirydd. Mae'n bleser gen I gymeradwyo'r cyfrifon terfynol i'r bwrdd y pnawn yma ar gyfer y flwyddyn ariannol ddiwetha ynghyd â'r adroddiad blynyddol, sef yr ail wrth gwrs i ni i gyflwyno ers sefydliad yma chydig dros 2 flynedd yn ôl. Ac mi rydyn ni wrth gwrs wedi cael sawl cyfle i wyntyllu y dogfennau hynny yn ystod yr wythnosau diwetha, ac jyst mwyn eglurder, mae'n werth falle atgoffa'n hunain, mi gaethon ni gyfarfod hynod o'r pwyllgor archwilio ar y 4 o Fai i fynd trwy'r cyfrifon drafft yna mewn cryn fanylder, ac yna'n ddiweddarach mi gaethon ni gyfarfod hynod cyhoeddus o'r pwyllgor ar y 19 o Orffennaf. Ac yn y cyfarfod hwnnw wrth gwrs mi gytuno ni i gymeradwyo'r cyfrifon terfynol a'r adroddiad blynyddol, ac wrth gwrs mae holl aelodau'r bwrdd wedi cael cyfle hefyd yn flaenorol i edrych ar y dogfennau hynny. Mae'n deg dweud bod ni wedi croesawu ansawdd y dogfennau yma. Mae wedi bod yn braf iawn cael adborth archwilio Cymru ag yr archwilwyr mewnol hefyd, ac i ni'n croesawu'n arbennig yr adolygiad a fydd yn digwydd ym mis Medi, pan fydd IGDC ag archwilio Cymru yn gweithio gyda'i gilydd i adnabod unrhyw gamau gweithredu all arwen at welliannau ar gyfer y flwyddyn ariannol nesaf. Dwi'n meddwl bod yna gonsensws rhwng IGDC ag archwilio Cymru y gallen i wneud y broses falle'n fwy ystwyth gan gyflymu falle y gwaith o gwblhau yr barn archwilio di-amod. Felly mae wedi bod yn hynod o braf clywed am y cydweithio hynod effeithiol sy'n digwydd rhwng y cyrff, ac oedd hi'n bleser o'r mwyaf gweld ehangder a dyfnder yr hyn sydd wedi cael ei gyflawni gan y corff yma dros y flwyddyn diwetha. A mae hwnna'n amlwg iawn yn yr adroddiad blynyddol sydd yn arbennig o glir ac yn torri tir newydd, dwi'n credu, o ran eglurder. Felly, ar sail yr datganiad yna, mae'n bleser o'r mwyaf gen i gymeradwyo'r cyfrifon terfynol i chi, gan fanteisio'r cyfle yma i ddiolch o galon i Claire a'r tîm am y gwaith rhagorol maen nhw wedi wneud i gael ni i'r lle arbennig yma. Fel y clywsoch chi gan yn cyfarwyddwr cyllid yn blaenorol, mae'r IGDC wedi cyfarfod ar 2 ddyletswydd statudol cyllidol sydd yn rheidrwydd i ni i gyflawni o ran cyllid, o ran revenue ag o ran cyfalaf. Mae'r 2 yna wedi gyfarfod ac yn bleser gweld barn archwilio ddi-amod ar ddiwedd y dydd. Fe hefyd fy negon ni fel pwyllgor yn bod ni'n awyddus iawn i weld y dogfennau mae'n cael ei hyrwyddo'n briodol yn y cyfarfod cyffredinol a fydd yn cael ei gynnal y mis Medi. Felly ar y nodyn yna, bleser gen i gymeradwyo'r cyfrifon terfynol i chi ynghyd a'r adroddiad blynyddol. Diolch yn fawr.
Thank you very much, Marion. And I'll hand straight over now to Claire to introduce the annual accounts.
Thank you, Chair. Diolch, Marion. I'm delighted actually to present the annual accounts for the financial year ended the 31st of March 2023 to the board for approval. The draft accounts were submitted to Welsh Government at the beginning of May, following the Audit Committee scrutiny on the 4th of May. And the main changes to the draft accounts are explained in the Welsh Audit's Audit of Account report that is included in the appendices. Audit Wales, as Marion already alluded to, intend to issue an unqualified audit opinion, and that is reflected in Appendix B, which shows the DHEW 2022-23 letter of representation. So following approval today, we will submit those accounts to Welsh Government, and for those of you who haven't already read them, those accounts consist of 5 key summary statements and 56 pages of accountancy notes. It shows that our performance against the statutory targets as outlined in section 172 of the National Health Service Wales Act in 2006 for the statutory financial duties and the administrative financial duties are complete. There are, however, four notes, changes of note that I'll make the board aware of. One of those relates to a number of presentational amendments. Most of those relate to the fact that this is the first year we've shown a cumulative position as DHCW. So again, a learning point for us going forward. There was one financial adjustment and one relating to which had one financial amendment. Again, not material in effect, but it moved our underlying position from 72 to 207. There was one non-adjusting event which related to previously related VAT reclaim against capital assets. Again, not material and not required to be changed. The feedback from Welsh Audit Office was we work collaboratively in an agile way. I think both teams, this was a new approach to the audit this year, which was longer in length and also deeper in scrutiny, which we welcome. But having said that, I think from both teams, we would approach it slightly differently and make it more efficient next year, and we would work together to get that sweet spot. And finally, there was one item relating to the manual set of accounts instructions, which we've again taken on board, and therefore we have completed a unqualified set of accounts for the second year as DHCW. And finally, I would like to say a great big thanks to my team, who have gone above and beyond again this year to complete the set of accounts. So I'm delighted with the results, but also really proud of the effort they put in. Happy to take, so I'm therefore handing the SHA board the accounts for approval. Thank you, Chair.
Thank you very much, Claire. And does anyone have any questions or comments? Well,
it's just a comment, Claire, and I hope people won't mind me saying so, but we're also very proud of you and your leadership of the finance and account team. We couldn't do it. We couldn't do any part of our business without that. So just for the record, you run a phenomenal team, and your leadership is very much appreciated.
okay. I'm sure on behalf of the whole board, I'd echo those comments and appreciation for the work you've put in. It's no mean feat to close the books in such a satisfactory way, particularly in the current financial climate. So well done to all. I might add, long might it continue. Okay, so we move on to the second part now of this of the formal of the statutory requirements in terms of reviewing and approving the. Well, I better just for the record, are the board content to approve the annual accounts? Yeah, thank you. And then move over to the annual report and ask Chris Darling to introduce the annual report. Chris.
Yeah, thanks, Simon. And this very much follows on from the annual accounts and the run through Ruth and Marion just gave. But just to recap, the manual accounts for accounts guidance sets out that all NHS bodies are required to publish as a single unified document a 3-part annual report and accounts, which includes the performance report, the accountability report, and the financial statement. So we're going to focus just on the annual report element of that, the performance and the accountability report. And the overarching requirement is for the annual report to be fair, balanced and understandable. And I know Helen Thomas, as our accountable officer, has challenged herself against that test a number of times before this came to the audit committee for endorsement to make sure she was comfortable it was fair, balanced and understandable. And that's what's included in the papers today. We have worked closely with Audit Wales, with internal audit throughout the process. We've incorporated their feedback and feedback from Welsh Government throughout the process, and also very grateful to the Audit Committee for their comments, both at draft stage and more recently when we went through the final draft of the annual report. In terms of the format this year, as is required through the Chapter 3 guidance. It is a single unified PDF document, annual report, but we have also in the background been working on an HTML version of the annual report, and this is very much the version that we'll be looking to promote wherever possible as we come up to our annual general meeting in September. And it is a first. It's a first for an NHS Wales body to produce an annual report in an HTML format. And again, really proud that we've been able to do that as a digital organisation. In terms of the AGM, it's planned for the 28th of September. We have delayed that date. Traditionally, we would have held it in July, but we are, along with all other NHS bodies in Wales, going for a September date, as annual reports and accounts will be laid at the Senedd by Audit Wales on the 31st of July this year. So we'll be using the September date for our AGM. And just to recap, this is a public meeting, given the opportunity for reflection, celebration and identification of key learning points for the future. And we'll be inviting members of the public and stakeholders to attend and, importantly, ask any questions of the board. So we'll be promoting that as we move forward. And just to pick up a point that our Vice Chair made at the Audit Committee a couple of weeks ago, was just to comment, I think Ruth commented on the annual report showing a lot of the achievements that have been made to date, but also underlining how much there is still to do in this space, which I think is a really important point for us to keep hold of looking forward. So before I ask the board for approval of the annual report, again, as Claire, I just need to express my thanks to all involved in producing the document. It does involve a lot of teams across the organisation. It's been expertly led and coordinated this year. It's a real privilege for me to present it today, and I had very little to do with putting it together. So I do want to put on record my thanks to all those staff that have input to it, but it's here for the approval of the board.
Thank you, Chris. And again, any questions or comments? Sam.
Thank you, Simon. I just wanted to comment on the HTML-ness. As you know, being a digital organisation, it's also my first year that I've seen our annual report and accounts. It's a really readable document, and they quite often aren't. So there's a lot in there that actually is it really gives you a flavour of what DHEW does, and actually creating the HTML document means that people will be able to dip into the bits they're really interested in. Just one comment is, are we thinking of HTMLing other of our key documents? Because we have some other documents which are really interesting, not just to me, but to the wider citizenship, which are just quite big chunky things. Are we thinking of doing this and making opening more of our stuff up and making it much more accessible and open to people?
Chris, that's a comms question.
Yeah, so I think we intentionally used the annual report, Sam, to start this process, to learn. And I think it's fair to say there has been a huge amount of learning from doing this in HTML format. The one thing we have had to do is juggle alongside having to produce something in PDF to meet the requirements of the guidance. So lots of learning. The second document that we've looked at and would be keen to do in HTML format is the IMTP. I think that's the other very public-facing document that we really should be moving towards doing. And as a digital organisation, as you rightly say, this is something I think we should be looking to do. It is resource intensive, and I'm really grateful to the graphics team who have been involved in this, and to you, Sam, for your input and advice on the journey. But as I say, lots of learning, and it is something we're looking very much to build on moving forward.
Marilyn? Oh, there we are. Oh no, you're back on mute again, Marilyn. You're on mute, Marilyn. You came off very briefly.
Oh, sorry. I just wanted to commend an annual report of this kind, because I think it's really, really good from a public facing point of view. I think people can pick it up and read it and really know the work we've done. I just challenge us in the future, where we've told, where we've mentioned lots of figures and information, to try to quantify that a bit more and qualify what in real terms that means to people outside the organisation. I think that's a challenge for us going forward. But I think it's good we've got the information there, but you know, when somebody picks it up, what it actually means to them, how it translates. So I think that's a further challenge we should give to ourselves. But an excellent annual report, and I think it meets the requirements of our partners, and I think it's very good as well for citizens to have a look and see what we're doing. So yeah,
point well made, and we do need to do that. And then we also have talked about outside this meeting how we use bits of the annual report in other ways, and maybe not necessarily in its full being, because even as excessively written as it is and as briefly written as it is, it still ends up as a large document. So finding ways in which we can use that in more bite-sized chunks is we don't want to just put it on a shelf, do we? It's an important piece of document in describing the work that we've done. And again, on behalf of the board, Chris, I'd like to, it's not just you, obviously, who's done this. It's a huge number of people, a big team has put it together. So if you could express the board's appreciation for all those who've been involved in producing the annual report, I'm sure the board would be very grateful if you did that. So thank you very much. So we will now, I'm going to ask you to approve the annual report, which I'm sure people are happy to do. Yes, thank you very much. I'll move on to the next item, which is Marion back in the chair again. If there's anything you'd like to specifically bring to our attention from the previous audit and assurance committee you had on the 3rd of July, Marion.
Thank you, Chair. And this is the Audit and Assurance Committee that was held on July the 3rd. I think it's a pretty clear highlight report, a number of standing items. So I won't go through the report in any detail, but can I just draw your attention swiftly to the Board Assurance Framework deep dive that we held, specifically on Strategic Mission 5, which is becoming a strategic trusted partner. And we had a detailed update on that area of activity, and it was pleasing to note that the plan is on track. Many other agenda items we've already referred to during the course of today's board meeting, but can I just finally draw your attention to 3 new policies that were approved: the use of Welsh language internally policy, the suspect packages and bomb threats policy, as well as the mental health, wellbeing and stress management policy. Diolch yn fawr. Happy to answer any questions if you have them.
Well, Marion, any questions, comments to note and receive that report? Thank you very much. And then moving on to the remuneration in terms of service committee highlight report of a meeting held on the 22nd of June. There were 2 items. We had a verbal update of the consideration and it's been given to senior staff overtime payments, and also it was the meeting in which we reviewed the chief executive and executive team performance appraisals for 22-23 and their objectives for 23-24. And I'm happy to take any questions. If not, if you're happy to receive that report. Thank you very much. And then moving on to the local book partnership forum highlight report. And I believe, Andrew, you were in the chair for this meeting held on the 6th of June.
I was indeed. There's no items to be raised for the board. The board's got a copy of the paper, so I don't propose to go through in any detail. There's just a couple of things to note on there. PADR's, the appraisals, basically. While the paper suggests there's a problem, I can assure you there isn't. We just notice a slight decrease in appraisals. We do continue to monitor these. A lot of this is, of course, because a lot of people's appraisals were due for review and they're currently going through that process. So it's just to assure the board that there's no problem there. Just another couple of things to note on the agenda. The community volunteering initiative to enable staff to volunteer in their local communities, particularly around digital inclusion and areas like that. So it's quite a topical area today, I think. And we welcome that. I think it's a great way of people giving back to their local communities. But also the really positive feedback we've had around the staff conference and awards this year, staff awards recognising people for their achievements. So I just wanted to highlight those few things really. But I'd welcome any questions anybody may have.
Thank you, Andrew. I mean, obviously I was at the awards, and it was a great event indeed. Any comments or questions? If not, people have to note the content of that report. I'm sure you are. Thank you very much. I've not received any items of any other urgent business, and doesn't appear that anyone wants to try and get some past me. So thank you very much on that. The date of the next meeting is seems like an awful long way away, but it is Thursday, the 29th of September. And just before I close the meeting, there's one person that we never see, but we always hear, who is leaving supporting us today, and that's Neris Hereford, who's been our fantastic translator over the last, I don't know how long it's. Oh, there we are. There is Neris. Well done, Neris. Welcome to the meeting. Though you've been there all the time, of course. So I'd just like to thank you for all your help and support. Well, I mean, it's not easy. It's not an easy job, and it's an even more difficult job when you're translating some of the technical stuff that we have to deal with, and the speed at which Ivan speaks as well. So well done, and thank you very much, Neris, and wish you all the best for your wherever you're going next. And we will do very well to get a replacement who serves us as well as you have, Neris. So best wishes for the future. And then Neris will probably disappear again. There you go. Okay. I'm tempted now to get Ivan O'Marion to have a long conversation in Welsh so that we get Neris hanging on. So Neris has been a fantastic support. I'll bring the board meeting to a close now. As colleagues know, we have a private board meeting. We're running slightly over time, but I think if people are content, if we do come back here at 1:45 at 1:45 for the private board meeting. So I'll see you all in 10 minutes. Thank you.